There's two types of patients. One, doctor, what are you going to prescribe me? Or doctor, what do I need to do to get better? We're in a world of reactivity. I'm the chief of neurology and I'm also the stroke medical director. The way I approach a patient is I listen. I was trained, you know what? You're going to take a history, give a diagnosis to a patient, or provide medication, treatment, or surgery, out the door. I used to go to conferences like 20, 30, 40 slides on the drugs. How much are we talking about food, nutrition, exercise? We're not proactive. We're not on prevention. So you don't learn from textbooks, you learn from patients. I train psychiatry residents and internal medicine residents. And then I said, wait, today we're going to let the patient talk and let's see what happens. The way they look at psychiatry now, their mindset is so different. I started to say, wow, this is working, this is good. Too many people are stuck in their brain, stuck in deceptive messages, unprocessed trauma. My supplement is a strategy, how to heal your body through healing your mind, learning how your mind works. So let's not look at someone as a condition. What is it you want to feel instead? The key here is to start
Dr. Resnick?
Yes.
Welcome to the show.
Thank you.
Of course.
Thank you for inviting me.
I have been looking forward, actually my team and I both have been looking forward to having this discussion with you because there is a lot of talk right now, especially post-COVID, chronic unexplained symptoms that people are dealing with. My audience already knows this, but myself has had my whole host of issues too. And I've been very curious. This has all led me down a path of reading books, you know, from Joe Dispenza, Bruce Lipton. I've gone down like the Alan Watts rabbit hole and whatnot. So when we came across your profile and we saw what you were doing, immediately my mind switched to like, where was this guy 5 years ago? You know, when I wasn't living in Miami, but like people like you are making a huge impact in a positive way, I believe, in the medical system, and it's very necessary. So for our audience, you know, you're a top neurologist. What did you start to see in your practice post-COVID exactly?
Thank you for inviting me and thank you for your words. Very, very sweet. I noticed in my practice since COVID, everything has changed significantly. And by the way, Dr. Lipton was one of the first books I actually read called Biology of Belief. And actually that most likely probably was the largest impact in my life when it comes to the subconscious. So a lot of the things I say is actually through Dr. Lipton.
Wow.
So COVID, all right. So COVID wasn't a virus. COVID virus attacked the immune system and the immune system went an exaggerated response. All the medications we're using, whether it was steroids, whether it was antibodies, was actually attacking the response based on a abnormal immune system.
Was there a specific case or patient story that came to your office where you were like, this is it, this is where I change my approach now? I know I have to do this post-COVID.
I really don't think, well, what was happening during COVID time was unexplained symptoms to me. And that's when I started to understand. So the uncertainty, I said, my God, like patient just got vaccinated and now they got numbness of their toe or something, or they believe they have a reaction to it. And then all of these symptoms I couldn't explain. So it wasn't really one patient. It was a series of patients and patients. I learned really much by patterns, as you can see. I don't like to judge but our brains are wired to really make a quick decision and prediction based on, you know, understanding patterns, because that's what we recognize. But I was seeing such a large patterns, and then I start to see the key is what I talked to you before, is that my patients were doing better when I was listening to them and when I was drawing them diagrams and explaining to them, and they were coming back without the need of medications. And I was like, oh my God, what's going on here?
I would like to get a little bit into your background.
Sure.
You were born and raised in Miami?
Yes.
And I read that you actually practice at the hospital that you were born in.
Yes, yes.
Okay. How'd you get into neurology?
Growing up, I had a really close friend. He was an athlete and he got into a traumatic brain injury. At that time, I did like somewhat medicine or biology. I did spend some time doing actually phlebotomy, like learning how to draw blood. And when he was in the ICU in the trauma center, I visited him and it felt weird. It felt comfortable, but uncomfortable, like you just said. It was like, wow, I really want to do this. I really want to help people. I really like doing this. This is so interesting to me. Yet, I was empathizing with my closest friend who was in a coma, and who's turned out to be a patient of mine now, and still a good friend. But it's not the same from the brain injury. But then I took a guide. I went through college, doing double major in medicine or pre-med and business, because I still kept it open. And then something came on. I was in Atlanta at Emory University, and I rotated at Grady Hospital there. And then again, at the emergency room. And I was like, okay. I guess at that time, ER, I don't want to date myself, but the show ER was going on. And I was like, wow, this is really cool. I want to do this. So I got in there and I went into medical school. And then I started to look at the brain, and neuroanatomy just clicked with me. And then it was interesting because in neuro, people were like, why are you going to do neurology? There's nothing you can do. See, the belief. When people tell me something, I think the opposite. I'm like, oh, really?
Same.
Okay, let's see. And guess what? Go to any therapeutic. Oncology and neurology are growing more than ever. If you look at the therapeutics for pulmonology, it's the same. Cardiology, it's the same. When it comes to neuro, it's growing and growing and growing. So at that time, yes, and I knew there was going to be more. And the brain itself and the understanding of the brain is still, we're going over this right now. There's still so much questions what consciousness is. And I was like saying to myself, like, I'm a doctor that studies consciousness. I don't even really know. And I'm waking patients up, and patients are in comas related to like brain injuries or what they call hypoxic injuries or whatever it is, drowning, whatever. So I'm constantly looking at consciousness, and now I'm starting to understand how the brain works. And then it just opened up my mind, as far as my mind is to really look and say, you know what, this is amazing. I can actually get paid for doing something that I love and help people. How awesome is that? How cool is that? So, you know, I'm living my dream. And a lot of doctors are walking around and they see how much I work. And I'm like, I work more than any doctor I work at. Now, using the word work is because, yes, I put the time into it and I make the time for it. But the way I handle stress is so differently. I handle stress like we talked about: growth, challenging, enjoyable, failing and succeeding, making mistakes every single day, learning from them. Yeah. Or protection, which is, I hate this, work sucks, my job, I'm in the hospital, I don't get paid enough, the doctor's this, the insurance companies, whatever. Yeah. And what does that do? That starts developing internally stress in your body. And what does stress in your body's interpretation does? Well, it changes your immunity, right? And what else does it do? It causes inflammation. So once I started to do that, I started to say, you know what? It's time to change the way I practice medicine, the way I practice neurology, because I was trained a certain way. I was trained, you know what? You're going to take a history, you're going to come up with a differential diagnosis, you're going to give a diagnosis to a patient, you're going to provide a medication, a treatment, a surgery, whatever it is, out the door. That's the way I was trained. Now, is that something I do in my practice? Yes, I prescribe medications, but it's a balance. You have to listen to your patients.
Same thing happened to me. And so I'm surprised, but I'm not surprised at the same time. In 2020, I had just woke up with numbness and tingling in all four extremities overnight. I was a runner, totally healthy, family's healthy, whatever. This is 5 years ago. COVID didn't even happen yet. It was like March, the first week of March. So that wasn't even a thing. By the time I even got appointments, it was now COVID. Now things were being locked down and whatever. And they were sending me from doctor to doctor. And I come from a background of family members who actually would rather deal with alternative medicine as opposed to just the allopathic way of doing things. But at the time when you don't have any answers or no one to go to and things are locking down, and you have such serious symptoms that like cause you can't even get up and walk, and I was like 30 years old at the time, it's kind of scary, right? So like the fear is kicking in like 10x mode. I look back and now I see how scared I was. In the moment, I wasn't grasping that.
Sure.
And I went to a neurologist, and I'll never forget him. I'll always remember this guy. It was in St. Louis, Missouri. That's where I was living at the time. And he does his checks, and I get like the muscle test, whatever the testing that they do. And he goes, honey, nothing's wrong with you. You're fine. He's like, I don't know what to tell you. And he like sits back and he goes like this, and he goes, do you drink? And me so proudly, no. And he goes, well, maybe you should have a drink or two. What he was telling me in that moment, and I got it immediately, like he was saying it with love and adoration is how I took it, was relax. Not literally saying drink, but he was saying relax, like calm down. At that point in my mind, just like almost everybody who's probably been down this path, is I'm looking for an answer.
Absolutely.
So that brings me to my next question. What is the number one reason people walk in when you see them and you're like, this is why this is happening to you?
Sure. That's the thing about my practice. People like don't realize that I am seeing. I'm not just in the office, like a hospital. I'm the chief of neurology, and I'm also the stroke medical director. So I started that program from nothing. Like we had no certification at the time. This was like 16 years ago. We went from what they call primary to a comprehensive stroke program. So now we like do everything. And when you come to see the neurologist, and the way I approach a patient is I listen. So I had a marriage therapist come, and I've talked about this story. Mm-hmm. And I train psychiatry residents actually, and internal medicine residents. And she comes in, and I learn from my patients. You don't learn from textbooks, you learn from patients, you learn from experience. Mm-hmm. So I said to her, teach me one thing about what I can do in my own relationship with my wife. And she says, well, there's a man, woman, and typically a woman likes to express themselves, they like to talk about themselves, they like to be heard, understood. The man typically wants to fix. So, not to get too much into that, I said to myself, my God, as a doctor, wow, this is what I do. Hurry up, let me fix. And then I said, wait, let's do this. I went to the resident, I said, today we're going to let the patient talk. We're not going to interrupt one word, and we're going to let them talk. And let's see what happens. I'm fearful, I'm scared, I'm concerned, I'm worried, I'm afraid. These are the words the patient's telling me. Now, do you go right away and say, oh, you have anxiety? Absolutely not. You have to communicate with the patient and empathize and say, you know what? These symptoms are real. What you're feeling is real. So let's go back to the box and say, what is going on as far as your nervous system? Now, yes, do I take a neurological examination? Do I do that nerve study EMG test? Do I need to do an MRI? Absolutely. But the next box is going to be, hey, let's find out what's going on with your life. Let's figure out what is the trigger. What are the culmination of possible micro stressors? But you don't want to tell a patient they're stressed out. No one wants to hear that, right?
But that is the number one reason people come into your clinic, right?
Well, it's life, right? Everyone has stress. The way we interpret stress and how our body interprets stress is right. But the number one reason people come to my clinic is not just stress. Remember, I'm a clinical neurologist, right? So I have inpatient practice, I have an outpatient practice.
Okay.
So in my inpatient practice, I take care of strokes, head injury, epilepsy.
Got it.
And in my office, which is an outpatient practice, it's follow-ups, and then I have new patients coming in. Mm-hmm. So there's a variety of patients that I see. So I see patients from all over, from clinical strokes, hemorrhages, brain aneurysms, injuries, whatever that is, and then I have patients that come into my office. Now, is it, oh, you're just stressed out and I have a patient with a stroke and I compare two people? No. And how I go through those approaches on my patients is very similar. Mm-hmm. So one of the most important things with a patient is listening, right? Two, what you just said, trusting the doctor, because when the doctor explains what you're feeling, if the doctor explains what we need to do, if the doctor explains your diagnosis, then that treatment is much easier, because believe it or not, the power of placebo, the power of belief, knowing that your doctor's on your side, knowing that everything is okay, boom, healed. And that's what I do in my practice, and I spend a lot of time. And I cannot tell you how many of my patients, and when I started to see that I was healing patients with mind changing, rather than medication changing, then I decided to change my practice significantly.
What is wrong currently, in your opinion, with how medicine is practiced right now, traditionally?
So much. That's why I'm doing this. One of the main reasons why I decided to come out and speak about the healthy mind is because I want to change it. And what's going on is that doctors like specialists myself have to see volumes of patients in order to keep up with our expenses. That's the bottom line. So you only have a certain amount of time with your doctor. Also, it's very pharmaceutical based. So I used to go to conferences, I still do. I go to conferences all the time. But who's putting on the conferences and promoting the drugs? Pharmaceuticals. So I walk in, and then let's say on Alzheimer's, right? So I want to know what's going on with Alzheimer's. The slides on Alzheimer's, or let's say Parkinson's disease, is all going to be on the new drugs out. How much are we talking about food? How much are we talking about nutrition? How much are we talking about exercise? One slide, 20, 30, 40 slides on the drugs. Yes, the drugs are great. I use it in my practice. But how about prevention? How about treating the patient? How about not being so differential diagnosis? Because we're in a medicine or world right now of reactivity. we're not on prevention. We're not proactive. So what we're doing is we're patchworking. In the hospital, unfortunately, that's what I do. My patients come with a stroke. Today, I walked in and a patient had a stroke. And I looked over and she's got a candy bar. She's got a Cinnabon. She's got a bunch of candy sitting on the tray. And I was just mortified. She's diabetic.
I have a question right at
Sure.
that one point.
Go ahead.
I have always wondered this.
Yes.
Again, because of my background and my family is just all about like cooking at home and whatnot.
Sure.
Why is it that in hospitals where it has everything to do with health, they have the worst quality of food that has absolutely no nutrition in it being served to people that need the highest nutritional foods possible at that time?
Great question.
I'm like, that kills me when I see that.
Yes. Or even walking into any hospital and seeing what around the hospital, what kind of restaurants or kind of cafeterias and the food that we put in. Absolutely. This is a society where patients actually, believe it or not, you're not going to believe it, they actually want to eat unhealthy at times. We should be promoting healthiness. We should be promoting actually quality food. I agree with you 100%. Doctors need to learn how to communicate with patients, empathize with patients, and then get really into their mind health. Because the physical body and longevity is the last box of my 5 pillars. You got to go into all of the other pillars to get there. Mm-hmm. Don't focus on the last box. Doctors are focusing on the last box. Because if you look at the psychiatry world, depression, ADD, general anxiety disorder, bipolar disorder, you could just disorder. It's a collection of symptoms placed in a manual of a box.
With a word.
And the pharmaceuticals say, you know what? Depression equals SSRI. You have fibromyalgia, so we're going to give you something called gabapentin or Lyrica. We're going to do that. And it's just pharmaceuticals will find a way to diagnose conditions. So let's not look at someone as a condition. Let's get to the higher levels here.
Yeah.
I have the metaphor as, so your mind is the author. Mm-hmm. The brain is the story, and the body is the book. So my metaphor is to teach that all three are connected, but teaching the mind and becoming the author of your story and changing that narrative, changing those chapters, that book, as it gets published, it's going to be published a certain way as long as you take care of the mind with the brain and body all together. It's all one. It's not separate.
But I don't think that this is taught to us at home or at school, at least it wasn't to me, where what you think, what you feel, what you believe dictates that chain.
Sure.
Right? Going down.
Right. In 0 to 7, you download these programs as a child, actually even 3rd trimester. A lot of the programs that are installed in us, we have no control over them. It's done. The brain wires itself, and the brain wires itself with efficiency. People don't understand that, and they are in their brain all the time, doing the same thing over and over and over again. So what does the mind do, the author do? It actually takes control of that brain and starts shifting it. That's the key. Mm-hmm. Because if you look at entrepreneurship, if you look at athletes, if you look at anybody in life who's successful, they figured out how their brains work.
It's true.
Why not learn it early? Because if you start learning it early, then you can do anything you want in life. Too many people, like you said about beliefs, and these limited beliefs that are stuck in their brain. They are stuck in deceptive messages. They're stuck. They don't see the outside because they're told they're not good enough. They're told they're not loved enough. And they go through their whole life like that because what they do is they're constantly looking at that confirmation. You know what? Boom. I am not loved enough. There you go. I'm not loved enough.
It's familiar.
It's right. And that's the subconscious, exactly. What's the subconscious like? What's familiar, what's known, and what's comfortable.
Yeah.
So you're going to guide yourself towards that all the time because the subconscious is looking for that. So that's why we'll talk about it. You got to set an intention and goal.
When you say 0 to 7 is when the programming starts.
Yes.
My immediate reaction is, well, that's, like you said, that's out of my control. Well, who is in charge of that? For most people, it's mom and dad.
Absolutely.
But now to the person with unexplained symptoms or dealing with whatever they are later on in their life, you can't just take that 0 to 7, my programming happened, and blame your family or your parents forever. I think this is where people like you come in and say, you can change and evolve and reprogram and rewire your brain and your neurons in real time at any point in your life, as long as you're willing to do the work.
That's the victimization role of, I'm a victim of this. I have parents that did this to me. My parents were alcoholics, or my parents didn't pay attention to me, or my parents told me this and this. Whatever it is wired, yes, it happened. But you know what? It's time to change that. When it comes to belief, challenge the belief. Go completely the opposite. Ask if it's really true. Because too many people are biasing, walking around doing the same thing over again because the brain is wired that way.
Are you familiar with exposure therapy?
Yes.
Okay, so what I like to do is, when you said question beliefs, right? Mm-hmm. This might not apply to everybody, but maybe you've seen people like this. For me, it's not about, maybe on some level, my body does follow the mind. But after doing years of work on myself with all of this, I have found that like, if I force my body to go do something, my mind will follow. So for me, it's like a two-way street is how I've seen it. So say I feel like I can't do public speaking. I can mentally question that belief. But if I can get over that question or fear or the unknown of that, like I don't know the answer to that right now, I just know that I'm feeling some sort of way, and I just get up and go do the gig on stage, now I know I can do it.
Sure.
And I feel fine.
Right.
And so sometimes, and it's helped some friends and family members who are like, well, how do I question my belief in this? And my whole thing is just go do it. Whatever it is, like just go do it. And when you move through that fear and you expose yourself to that over and over again, now I have a new belief. I can do public speaking.
Well, it's more than just belief, it's the wiring of the brain. So
doing it causes the rewiring, right?
So in the temporal lobe, there's an almond-shaped structure called the amygdala. And then the amygdala learns and conditions very differently than the brain. It learns, its basic job is to make sure you're safe and secure. Okay? When that thing goes off, it can take over your body. It's called the amygdala hijack. It can take over. So taming the amygdala, or even talking to the amygdala, is actually exposing it, because once you expose to it, whether you have a fear of flying or whatever it is, once it feels that you're safe, it doesn't go off, because the amygdala fires that sympathetic nervous system. And it activates the sympathetic nervous system. It puts you in full-blown alarm. When it comes to fear, it's that your brain is wired for protection. So what's it going to do? It's going to prevent you from dying or survival, right? So it wants to keep you safe. So that amygdala wants to keep you safe. What you just described also, though, which I love the fact, is confidence. See, I have done change therapy where I have patients all the time. And I ask patients what they want, calm. The number one antidote to anxiety is confidence. Because when you feel confidence, and you just did it with your body, is you actually shrugged your shoulders and felt confident. Because when you feel confident, you can do anything. Most people have fear and they're not confident, because then they start second guessing, or there's uncertainty, or fear of this threat, or fear of shame or rejection, because they don't want to go through the same process what they felt. Just go do it. Now, to be overconfident, no, you want to be prepared. I mean, as a doctor, I feel very confident with my work. I can go in and I feel very confident. When I walk in the room, I know what I'm doing. I mean, I can just know it. Yes, are there times that I have made mistakes? Of course. But I feel confident because I'm prepared. But I have the confidence in me, you know. And the fear is not fear. When you're up with an emotion, what's the best emotion to put? Up with excitement, challenging. Mm-hmm. Let's do this. Let's get up on camera. Let's do this. Let's go. Because once you start changing that and you use the chemicals of dopamine, right? And you're using all the adrenaline, and you're starting to use it in your favor, then boom. Yep. Then that's confidence.
That's a good example, because I think that's what athletes do too, right? Before a big game, sure. Even if they have nerves, or they have, even performers, when something is like a little bit nerve-wracking to them, they, in their mind, somehow can manipulate that energy or use it for like fueling them, as opposed to making them shrink back. It almost propels them forward.
Sure.
And I do think of that in my mind before I'm doing something. I'm just like, this is just going to fuel me more.
I heard this metaphor, which was so good. It stuck with my mind. It was that someone was telling the story about someone who was really nervous about something, and they were having butterflies. Mm-hmm. And the coach or the trainer says, I know you have butterflies. We'll put the butterflies in formation. So that just tells you, boom, take the butterflies, put them in formation. Now you're in control and move forward. And kind of that metaphor sticks with me because I talk a lot of metaphors because it bypasses the critical mind. And when you get into change therapy and imagination, then you start to realize that these metaphors are so powerful because then it clicks. Just like what you did right there, it just clicked. So that makes sense. You know what? Let's put my butterflies in formation. It makes me feel good. You know, I got this. So those are the things I do. And that's, this is what I do with my patients. I get them confident. I make them feel good. They walk out knowing. Now, do I do it this first visit? No, a first visit is more of a serious visit at times. I feel my patients. I kind of feel if they're bouncing off, what I'm saying is bouncing off the walls, because I have patients that forget it.
Yeah.
They're in doctor mode, like they want a prescription, a drug, and they want to be fixed. They don't want to put the work into it. That's a majority, unfortunately, patients. And I've always, I don't like to use the word always, I've discussed this, is that what is the best patients walking in? There's two types of patients. One, doctor, what are you going to prescribe me? Or doctor, what do I need to do to get better, right? So what are you going to do for me? What am I going to do for you? I said, I can help you and I can tell you how your brain's working. I can tell you the diagnosis. No, what do you need to do? What do you need to get better? Because in this world right now, of the world of GLP-1s, right, of Ozempic, and patients taking them and feeling good about their weight loss is all a barrier of this, not here. Because why are we overeating? Why is that subconscious mind and those habits, which we didn't get into, is processing all of these layers of agitation? Why are you doing that? See, so we're in a model system of just symptoms. In this box right here, you're never going to get better unless you've healed through the mind.
Yeah. I would like to go there a little bit, actually, because I've been reading a lot about this too lately, is why do people, if you've noticed, if you're like a constant snacker or you eat very large meals, there's a reason for that. And it's mostly emotional. You're filling a void of some sort. And it's unconscious at this point for you. You don't even know you're doing it. It's interesting, like the days that I have the most stressful days at work, number one, I won't eat all day because I'm so busy. And then when I do and I want to, I don't do it anymore, but my first thought is like reach for anything in the cupboard. Well, if it's a candy bar or a healthy, gluten-free, whatever, but it's packaged and processed, right? Well, you're still like looking for, that was trigger, right? That was like filling something in because all day I just did was manage my emotions and try to like work through things, right? And people do that all day.
Of course, yeah.
Long. And the truth is we don't even need that much food.
So I like the word noticed, because the word noticed is a very powerful word for the subconscious. It actually takes the mind and starts noticing. See, that's awareness processing right there. So the word notice, but you didn't get into why don't you do it anymore?
Don't snack or don't reach for sugar.
Yes.
A lot of reasons. One, I'm a forever learner. I love growing. They did a personality test on me and they said like my main thing is growth. Like I always have to be growing and evolving. And if I'm not challenged and I'm not moving to my pace and I don't see progress in my life, I'm not happy, you know? So for me, it's like, how can I get better at this? Like my husband's super into fitness and all this. So am I, but he's like protein, carbs this day, no carbs this day. You know what I mean? Like he's very regimented. Sure. And so for me, I'm a vegetarian, so I have to really be careful of my carb intake and get enough protein. And being in Miami, that also I make it seem like I have a sugar problem, but I really don't, or that I'm overweight. It's not the problem, but it's
you're human. When it comes to a habit and wiring of a habit, what drives a habit and what a craving is dopamine, right?
Correct.
So the first part of the habit loop is a trigger or a stimulus or something. So then the action, the behavior, the routine is what's wired. Then afterwards is a reward, okay. So let's go into overeating. So I got home from work, I was stressed out, I feel, I need to reward myself. I just feeling a little agitated, food, right? Reward, I don't feel agitated anymore. Wired loop. The more you do it, any habit with repetition becomes wired. So that's part of one of my principles is our brains are wired for efficiency. Our brains burn 20% fuel. you can't be thinking all day. You'll burn out. You'll burn the bulb. So the brain runs on subconscious programs and habits. So everything I talk about, for the most part, is habitual. Worrying is habitual. Anxiety is habitual. A lot of things are habitual. How do you get out of a habit? What you just said before, notice. And then noticing the trigger, noticing the agitation, feeling it. Once you stop that and start noticing and become aware of it, then you start to substitute it with a different behavior, which is learning, let's say. Because the reward at the end, people go on and be like, oh, you overeating, it makes you overweight. You know, people are eating because they don't even know that they're eating. The next thing they know, they're home, they're eating, and the food's in there because we're wired. You already had a long day at work. Your brain does not want to think about anything other than feel better. So you're rewarding yourself, and that's what happens. And it happens with so many things. But that loop is so important to understand, because what I do with my patients is that I start drawing that loop. And the GLP-1 does not help with that loop. It is a Band-Aid, because once the weight loss comes back, you want to enjoy a diet. I talk about this all the time. You know, all these diets, I'm in the elevator or I'm on social media. Sweet potato is good for you, sweet potato is bad for you. Or organic and counting the macros and all this stuff. Like, you got to live life, right? So I'm a big believer of working out, exercise, diet, but enjoying foods. I mean, you have to. You can't be so regimented like that. So you have to have balance in life. And that's another principle I try to talk about, is homeostasis, allostasis, having balance. Because when you exercise too much, then it takes away your relationship. It takes away your inner feeling. You know, people that work out a lot or enter the bodies a lot, and too much, it's too much. So you have to have balance. And I'm very, very much like you, is I love growth. And we have a conference in the morning called the Neuroscience Conference that I put together, that every morning, neurosurgery, neurology, interventional neurology, the ICU, we all get together and we have a conference. And I come with a cup of coffee, I sit down, go over the patients, and I need to learn. If I don't learn 2 or 3 things, my day is off.
Yeah.
Before that, I meditate, but yes. So I definitely am very regimented like that, and learning is the antidote. It's the key. It's so important in life. Building what we call cognitive reserve, enjoyment of learning, is so important for mind and brain health.
I will also say one more thing. I think being able to apply that. We know people who are sponges and they soak in all the knowledge, but then they don't know what to do with it, or they don't put it into practice. Because learning everything is great, but then how does it affect your life? You have to apply it and, like you said, do the work.
Gotta do it.
Right? You have to do something with it.
Well, the key is, you know, the word work, because you hear a lot of people like, yeah, you gotta put the work. You know, if you learn how to use your brain efficiently, then, and the brain doesn't like limits. So when you start saying like limitations, then it starts to limit itself. There is a language, and I have a whole chapter in my book talking about it, because when I was studying like hypnosis and I was like listening to how you can get into the brain, there's the word notice, the word limitless, the word effortlessly, the word, you know, there's so many different words that I use that I put in what we call a language diet that expands the brain, that makes it easy. So once you know that it's easy and you don't have to put the work into it, then it is easy. You just have to you have to do it with repetition, and that's the key. That is the key. The more you do it, because your thoughts, your beliefs, all of that is through repetition, repetition, repetition. I talk about the subconscious brain as a big habit loop. Yeah. And the more you start to become aware of that habit loop, then that's the path to feeling better.
I don't know where I read this, but it's helped me tremendously, where you're right. Sometimes the word work turns people off, right? And it's like, oh, can't do it, give me the pill. But if you could accept the fact that you were once different than you were now, and you were okay, right? The better version than you, that was the natural you. You didn't have to work for it. That was you, and all you have to do is get back to that, to your homeostasis, to who you naturally are. Like, I believe we're naturally supposed to be thin. I believe we're naturally supposed to be healthy. We're naturally supposed to be happy. We're naturally supposed to feel love. All those things are ingrained in us. That is who we are at our core. Everything else is learned behavior, unprocessed trauma, unprocessed emotions, stress, and on top of it, you not knowing how to handle that.
I beg to differ on the way we wire our brains about happiness. I'm not sure that we're wired for happiness, because we're really wired for survival. It doesn't mean we can't achieve happiness, because we really need to pass our genes off, and the survival of the fittest, or whatever it is, the way you look at it. If you use, again, the mind and brain to understand that, you can wire yourself for happiness on some of the other principles I discuss, which is, enjoying the moment and social connections. We're emotional beings, number one. We're social connected beings. Our brains are wired for emotions. And these emotions that we're going through, our brains are trying to understand all these emotions through processing it and meaning. So for instance, our mood throughout the day is changing all the time. So we use these words, I feel comfortable, I feel calm, I feel relaxed. We're interpreting the meaning. Or then we get angry, we say, okay, I'm angry, whatever. You start meaning. So things, you need meaning because the brain is lost without meaning. So we have to understand that if we use the emotions the correct way and process them the correct way, that's so important. And to me, I'm more of a person that I've wired my brain to positivity. I watch the news very briefly just to see what's going on. But give me a hero story or something that's going to gravitate me with emotion. Let me see someone winning a championship. Let me see somebody talking about something that they won or someone who they saved or whatever it is. Give me that story, because that emotion is going to pump me up. It makes me feel good. And that's what my brain is doing. And there's a law where I feel that life is all gravitational. And when you're positive, you're going to bring positivity to yourself. Gravitate. And I'm not saying people, because in the medicine world, we have to be very careful, because my brain biases too from all the patients that I see. When I started to learn about the epigenetics, and I started to see cancer in young people, and I'm seeing so many conditions in younger people. Why is that? Our foods, what's going on? And yes, there's environmental carcinogens out there, of course. I believe that most of it is unprocessed trauma. It's the era that we're in right now that we're not able to process these traumas correctly. See, when you go into my practice with patients with migraines, most of my patients that come in with migraines and headaches are women.
Yeah.
Is it because women are more emotional, or women are more hormonal? No, women do a lot more than men, really do. I talk about this all the time, and I'm very free about it. I say women have responsibility for keeping a house, have responsibility for keeping a marriage as well, have responsibility for the children, have responsibility as you get older, and women live longer. I was in the elevator again the other day, and you can just hear the people talking about, even social media, organic this, organic that, take this teaspoon of teaspoon. I go,
Biohacking,
peptides, all this stuff. I'm like, this is all BS. I said, look, I'm in the arena. I see it all the day. When I saw a patient today, she's 9 years old. I saw her today with her 2 daughters, and she's got a tango. And I go, you're 9? She goes, yeah, I play tennis, I dance, I'm active. She came in with a mild neurological condition, but she's 90. And that's longevity to me. Her quality of life is, and I'm asking her what her habits are. So this is what I do in my practice. I learn from my patients, like, what do you eat? I eat this and this and this. Oh, so you do have scrambled eggs. Okay. All right. You do put bacon on it. Okay. All right. So okay. So that's food. Okay. Is it every day? Is it a lot? Is it excessive? No. And she's thin, right? I said, what do you do as far as what's your mindset? And I listen to her mindset, how she handles stress, how she processes emotion, how she goes to dance class, how she's on the computer learning. See, to me, that's longevity, not this stuff we're getting on the internet of crap, of injections and all this stuff. So I'm not promoting supplements. My supplement is a strategy. It's a strategy how to heal your body through healing your mind, but just learning how your mind works.
Yeah, it's going back to the basics. And I love that example that you shared of this woman that you saw today, because everybody that I look up to across the industries, in their 40s, 50s, 60s, 70s, one thing I have seen common in everybody, and I've interviewed some of these people, is that they have a very open mind to, I can do anything. And if they want to do something, they don't let their age determine that factor at all. As they get older, they don't become more limited. they become more limitless. And you touched on this word earlier, where if they want to take up surfing at 70, they're going to do it. If they want to go lift weights now after never doing it in their life, they're going to go do it. And I believe that is the key to longevity, but that has a lot to do with your mindset, your emotions, and your belief system. That's the root, right? That's our foundation. Some of these people have learned this through trial and error in life. Life has forced them to learn these things. I would put myself in that category. Like I had no choice but to learn to grow, right? Other people have parents who have raised them that way. They saw parents behave that way, where they were very nimble, limitless, flowing with life, doing things. They have grandparents who may be affected that. And then there are the ones who believe that, hey, when I'm 60, my mom broke her hip, so, it's coming for me any day now, And then when you say that out loud, your grandkids or your kids are listening to you. And that's where I believe it starts.
I could not tell you the stories I see in my office. On patients that come in. I saw a 19-year-old person was having chronic headaches, and she's been listed as a diagnosis of general anxiety disorder, depression, all these labels of these conditions. And her mom had polio. She grew up with her mom disabled, and she was talking about her mom, and she's like her mom. She's becoming disabled, and they don't see it. And the mom is just using words. She's just like me. She's just like me. And the child, I'm saying a child, she's 19. Yeah, is trying to interpret those words. Give her to me. Give her to me. Let me have her. Let me teach her. Let me work on that. Because when you're wired in there, you don't see it. Your mom is talking to you in a certain way, saying certain things to you. You believe everything that your mom's saying. It's your mom. And you're connected to your mom. This is your mom. This is why family's so strong. So a lot of the people that are following the herd, okay, are basically doing the same thing over and over again because it's comfortable. What's known as familiar. Our brains are not wired for change. It's not. It recognizes the patterns that we see that we've downloaded. It accepts those patterns. It acts on those patterns, and it goes on and on and on and on. It doesn't want to change because what does change? Change requires somewhat element of work, more energy of the brain, and so and so. So I get all back into the same principles over and over again. So once you start learning these things, you can start changing how our brain works, but not so much the brain. Because when you said it before, I think in the beginning, is that when you're in it, you're in it. When you were sick, that's what you said, or you weren't feeling well, you were in it. You were in the movie. You don't see anything. Your brain and that sympathetic nervous system says survival, and it's going to want you to survive, explain, and feel better unless you get that help, right? So you got to take yourself out, that's the mind, and say, wait a minute, what's going on here? Let's change the story here. Let's change it. Let's change the wiring of our brain, because the brain is very plastic. It's very dynamic. It's not static, meaning it's stuck. It can grow, and it grows by learning, and it grows by learning over and over again. And that's how you learn emotions. That's how you learn habits. And it's basically learning, because learning is processed through a neurotransmitter, dopamine. It's the same transmitter.
Yeah.
So we wire ourselves through these neurotransmitters. So all these metabolic conditions that we're seeing, okay, I'm not talking about cancers, but I'm talking about metabolic conditions like diabetes and heart disease, and all of that is basically due to stress in our environment. Now, it's environment, and then it's internal environment. It's our own environment. Somewhat we can control the outside environment to a certain extent, so you could, but you could definitely control the internal environment by doing all the things that we talked about.
Is it true that if your internal environment is optimal, not perfect, but optimal, and say you do have some toxins in your body, environmental toxins, your body will be okay and you will get through it and maybe not have any symptoms because your internal health is fine. Your mind is okay.
So there's these functional doctors so functional medicine, I got to be careful because, there are doctors, they take patients that don't feel well and they gravitate towards like a patient and be like, we know what's going to be. Your mercury level, your, whatever the levels they find, and then they hit you with something and give you that answer that we talked about. And I'm like, God, really? Sir? I just, look, yes, tuna has mercury, right? And if you really break down the mercury levels, and yes, you're going to break down, that is not the cause of your anxiety. Yes, if you had nail changes and your hair loss and you had GI symptoms and skin changes and nail changes, and you get into that, that's toxicity because it's a whole toxicity. It's not going to just cause that anxiety. So let's rewind and and let's get into why you're not feeling well. And let's put all of this stuff, because like you just said, people are on the internet. I've seen this all the time, all these detoxes and all of this stuff. I'm like, I roll my eyes, and yes, I don't believe it, and I'm fighting it, because the reason why is because I see it all day, and I see what my patients live longer, what they do, and how they live their life, and I want to mimic that, and I want to use it. So I actually am working on, I have patients that are over 90 and a few in their hundreds, and I'm working on a documentary to just sit there and talk about all the food they put in their body, which is...
We've got some wine and cigars in there, I'm sure.
Yes. Oh my God, scotch. I have a guy, I have a picture, 97 years old, drinks scotch every single day. Okay. So, okay, scotch works for him. Might not work for somebody else, but it works for him. He's doing something right. He's got low BMI. He walks every day. He's on the computer working, keeping his mind active, right? So it's not going to be all in one. Everybody's different. Like you said, everybody's system is different. Everyone's balance is different. Everybody's different. But the thing that we all share in common is the wiring of our brain. And learning how to author your story is so important in changing that story. I practice medicine balanced. I use medicine. Like a patient comes with migraine, I have patients that I treat with migraine medications. The new medications actually are wonderful. I do Botox for chronic migraines and all these things. But it's not that I just put them in this loop of just headaches and diagnosis. I'm a doctor. I'm going to help them. I'm going to make them feel better. I want to get them off of it. Let's get into your sleep, exercise, diet, and your brain health, which is the foundation.
How did your colleagues start to respond when you were changing your approach with your patients?
So I never really asked my colleagues. I don't know if they think I'm a little quirky like that or I'm a little different. I walk into a patient's room and I'll ask them the craziest questions. Just to get them off guard and then open up to me. The residents that come in, they come into my office, they put 3 rules. I go, number 1 rule, be on time. Okay. Number 2, no cell phones. Don't put your cell phone in front of a patient. You want eye contact with your patient, you want to listen to the patient. You put your cell phone, it means you don't care. If there's an emergency, you can walk out. And then number 3, you're here to learn. That's it, you're here to learn. I don't want you typing my notes, you're here to learn. Those are the 3 simple rules. Okay, very easy rules. When they come in and they spend 2 months with me, their mindset is so different, the way they look at psychiatry now. And I started to say, wow, this is working. This is good. So what I'm really not looking for my colleagues' acceptance, what I'm looking for is my patient's acceptance. Because I tell them, how do you build a practice? I have never advertised. Do I care about my Google reviews? Hell no. What I care is that patients refer patients. Patients' family refer patients. That's how you build a practice. When I see I'm taking care of a whole family, I'm taking care of friends of the family and the community, then I'm good. I don't need the noise outside.
When you started to change your approach after COVID, did you naturally see a decline in how many prescriptions you were
Absolutely
prescribing?
I stopped prescribing sleep medications and SSRIs like crazy. It's very rare you're going to get one out of me. Very, very rare.
How do you handle when somebody comes to you though and is expecting that?
So the medication is a tool and it's for stabilization. So there are some psychiatric conditions or neurological conditions you need to stabilize. So, and then I will refer to a psychiatrist, psychologist if I need to. Yes, there has been patients be like, you're not giving me anything? I go, I just gave you the prescription. It's called the mind-body prescription. And you can put it on your kitchen refrigerator if you want. I said, that's what is it? I am not treating your symptoms. You're not sleeping at night because your brain is not turning off. How are you going to do that? That's the prescription. That's a big deal because, I have trouble at times with patients, and patients expect a lot of things based on their beliefs of doctors should prescribe medications. And I do. I order tests, I do medications, I do it, but it's balance and it's listening to your patient.
Can you share how you do turn your mind off?
So turning your mind off or keeping your brain quiet is through meditation. And I learned how to meditate on my own, and then I started to look and read and so. Meditation is a tool, and the more you do it, the more you understand that distraction is okay and being okay with your thoughts is okay. I can turn my brain off because I crave at times boredom and quietness, because I have patients and people in front of me all the time that I want to just sit with my thoughts and allow some of that worry to come out, and then breathe and meditate and then clear my mind. And when it comes back through meditation, bring it back, but be curious about it, not reactive about it, and say, well, we'll address that later on. Because if your brain alarms to it, or the brain wants to suppress it, it makes it louder. See, the thing about the brain is that it's counterintuitive. Your intuition is to do things a lot. It's actually the opposite. People think like with anxiety, it's like anxiety, you want to allow it. You want to gravitate towards. You want to bring it on. You want to feel that emotion. Because the minute you suppress anxiety, or the minute you distract it, or the minute you do something, it comes out louder. So I always tell my patients and myself is feel the emotion, right? Feel it. Label it at times. Feel the emotion and allow it. Not suppress it. Not fight it. Think about it, right? If you're in a plane, right? If you grab on like this, one of those fearful flyers, more tension, more sympathetic nervous system, more of the nervous system firing away, more anxiety. Or you can be like the guy next door with the newspaper snoring back and forth, right? Just like not a worry in the world. Why is this guy worrying? So the key is to allow it, feel it. Don't suppress it. It's your brain and body telling you there's something wrong, And I learned these things just through patience, reading and understanding. I'll never forget, believe it or not, I used to be afraid of many things, of course, and one of it was social speaking. I was in the neurology residency, and for some reason I was the one always called on. Mm-hmm. And to a point where I used to like hide or be in the back, and it was like, "Where's Resnick?" And they would bring me out, and my legs were shaking because the doctor, who was a renowned doctor, wrote a textbook. We had to wheel the patient, know everything about the patient. He would find something to really nail me. And I felt the shame and the rejection and the sweating and people thinking maybe I'm stupid or whatever it is. That started to develop. And then I'll never forget, I was in Chicago with my oldest son. And I talked about this on one of my podcasts, is that I was in the front row. And the comedian or whatever it is, kind of like improv, kind of like looked at me, asked me a question. And it brought me back to, looking retrospectively, brought me back to like being called in front of people. And I was like, all of a sudden, sweating, hearts palpitate. And I did something there. That's what got me. I said, holy cow, this is so cool. Like, oh my God, my heart's racing. It's telling me there's something wrong. There's nothing wrong. I said, this is my heart telling me. Right there, he asked me a question. I answered it. So happens like a few months ago, I was at improv, and they asked anybody here who's very habitual, and they put me on stage, and I had fun with it. At this point now, I do a lot of social speaking. I enjoy it. I don't mind if I make mistakes. It doesn't matter to me. I overcome, like you said, with exposure therapy. So the whole idea about that is that what I just did was I just trained my brain to allow it, feel it, be okay with it. Because your intuition is to fight it, to run away from it, to suppress it, to brush it off, because it'll come right back. So you got to feel it.
What is when people are ruminating? I don't know how to say it.
So rumination is just a thought. Usually it could be a specific thought of something that's going to happen or something that is happening, and it's just something over and over again. It's a part of the brain called your default mode network. It's a network of the brain that has connections in the prefrontal cortex and what they call the posterior cingulate that connects, and it's your internal narrator, and it's the area where you ruminate. It's where you are daydreaming. So the default mode network is very active in conditions like depression or generalized anxiety disorder. And mindfulness is well known, like with meditation, actually quieting the network down. So you asked me before about how do you quiet your brain? That's what you're quieting, is your default mode network, is thinking of things from the past and the future, daydreaming and thinking about things. Because a lot of times what we're doing is we're predicting the future and we're in the future. And a lot of times uncertainty takes a big toll on people's body. People don't understand how much tax and uncertainty does to a certain person when they're not okay with being uncertain.
Most people have a difficult time falling asleep. What about the ones where it's easy to fall asleep, but like you wake up at 3 o'clock, 4 o'clock, 5 o'clock, and that's it, you're up? Obviously that's me. I'm always up at 5. but I fall asleep like a baby.
That's good. So that would take a while to take a whole history. There's so many things that can't be. The key is that there's initiating sleep, and then there's staying asleep, keeping asleep. And then whether you're hitting the stages of sleep, you got to go into sleep hygiene. You got to go into caffeine exposure, because at a certain time of day, you need to cut it off. What time you're exercising, how much light exposure in the morning, how dark it is at night. When you wake up, what are the things you're doing in the middle of the night? Are you clock watching? Is your brain thinking of things that needs to get done the next day? So you can go on and on those things. I have a small little segment on my YouTube channel talking about the very active brain and how to quiet the brain. So there's so many ways to do it. Understanding the mind and brain, what it's doing, because typically insomnia, people come in with insomnia and I'll be like, okay, so let's talk about your insomnia. What are you going to prescribe me, right? Oh, I'm going to go see a psychiatrist for insomnia. I go, oh, you're going to see a psychiatrist for insomnia. So again, your insomnia to me is a symptom. Now, there are conditions called parasomnias and circadian rhythm disorders and obstructive sleep apnea. There's so many other conditions. I'm not getting into that. But the common person that comes in my practice, that box is insomnia right here. Mm-hmm. So let's get into exercise, diet, sleep, all the way, that healthy mind 5-pillar approach. Let's go to the first part of the healthy mind. And what are you doing to calm your brain down? Are you clock watching? Are you thinking about things? So I like metaphors, and typically I'm a big fan of when the brain starts to become very active and starts worrying, because worrying is a very tricky, false predicting part of the brain, which we did not get into. That's that part of the prefrontal cortex that works with anxiety and makes anxiety worse, because people are worriers. Worry is problem solving, basically, and false predictions, basically, right? I mean, most of our worries don't come true. Right. So I am a big believer of worry breaks during the day. If you're a big worrier, where you say, okay, look at the mirror 10 minutes and just start worrying, and you're going to believe it, you will not be able to capture things to worry about. But at night, I like the metaphor of filing it in a file cabinet. Wow, this worry came out now. That's interesting. Why does it come out now? Is it helpful? Is it hurtful? Let's file it. And worries have two basic, if you take worry, just two simple things about worry. One, is it a problem right now? No, then it's a worry. Number two, is it a problem right now? Yes. Can it be fixed right now? No, then it's a worry. That's it. That's the way I do it. And they're like, what? Yeah. And then let's take that worry and file it.
What does average day look like for you, if you don't mind sharing?
Like I said, I do office and hospital. So I wake up, it could be anywhere between 5:30, 6, depending if I exercise or what I decide to do on the schedule. Most of the time I do it after work, because the mornings I have to get to the hospital. I prepare, so I'm very habitual but efficient. My suit or my scrubs or whatever is set, shower, and then I eat very healthy. And then I grab a cup of coffee. And then in the ICU, which we're somewhat lucky, is that our hospital faces the water. And also the families usually are not in the waiting room that early in the morning. So I'll drink coffee. Maybe I'll listen to a podcast, and then I will about 15, 20 minutes meditate. They know, like the nursing staff knows that, like, on my corner is my meditation zone. And then I'm ready to roll. And then all of a sudden I open those doors, and then there's just a little bit of chaos, if you think, which is not so much chaos to me. It's very fluent and very comforting in a way, which is strange. And so I have patients on ventilators, and it's very intense. And yes, it could be very emotional, but you put your doctor zone on. And that's the key with what I talk about is identity. It's like one of the, we'll get into identity, because I don't want to backtrack. But so my day is going into the hospital, and then we start a conference. So I round on patients, conference, round on patients, and then I get to the office. And then at times I have to go back to the hospital, depending if I'm on call that day. Mm-hmm. But I cut out at a certain time. I cut out like around 5:30, believe it or not. I get my stuff done. I exercise from 6:30 to 7:30, spend time with the wife and the kids. My kids are a little bit older now. And then possibly do some work as far as, with a healthy mind project that I'm doing. Mm-hmm. And then repeat. I'm lucky to have a relationship, and I talk about this a lot, about a wife who is like, decided to be a housewife, who's extremely we met in college. She's super smart. She could have chose any type of work, but she chose to take care of the kids at home and help with the finances. She allows me to do the things that I can do, because I can't get my things done at work and life if I had to do all this stuff at home and deal with a lot of the things in my house that I have to keep up with. And so it's a team, it's a partnership. I can't say I am who I am without her, because she really allows me to do all of these things. So that's usually the day. And so I have a balanced life. I keep my work now this is the other thing, is that, a lot of the beliefs are work is work and your life is your life, and you separate those two. And I really don't. My work is my life.
You integrate them.
I integrate it, but I enjoy it, and I like it, and I love it. And you know what? Yes, I got called, and it's a distraction here, and it's annoying at times, but I'm helping somebody, and I enjoy it. So it's not taking away from me. Yes. Do I wish with 2 of my kids that I spent more time with them? I'm human. Absolutely. My wife had to make a lot of decisions on her own without me, which I believe were obviously right decisions. Yes. Looking back, yes, I wish I could have gone to more soccer games and more basketball games. I chose a profession. So do I feel bad about it? Well, I do, but at times I don't. I feel that what I'm doing is supporting the family, supporting my kids, and no matter what, they understand that I love them, and I'll never forget my oldest son, who's in finance, and when he was in high school, they don't talk back to you. He said one word. He said, "Dad, you're being such an a-hole," or whatever. And I said, "Whoa." I said, "You just call me that?" And I said, "You know what? You're going to wake up at 5:30. You're coming to the hospital with me. You're going to see what it's like for me and the choices that I do. And you're going to see why I did this and this." And it somewhat backfired, because he doesn't want to look at medicine at all. But he respects what his dad does, and he respects what I do, and he respects the quality of life and the things that I chose to do. And obviously he's never called me that name again, and which is a lesson itself. But what I'm saying is that there's got to be a balance of work life, but there's not a balance. Everything's together, everything's integrated. And when you talk about longevity, the people that live longer, and that's why I talk about men and women. Men identify their purpose in life with their work. And once they retire, I deserve now to retire. I deserve to sit in front of TV. I deserve this. Women, typically, they keep going.
Oh, they want to be involved with their kids still, their grandkids, and they find
Absolutely.
a purpose in there, and they're needed, and
Absolutely.
I have seen this personally with people. The guy is retired at 61, 62, and then he was fine. The decline within 24 months, cognitively, he was totally fine. Like, he didn't want to retire, and you just saw that, like, his purpose was, nobody's fault, but like you could see that.
Right. So that's right. And when you see typically, I say typically because it's a patient coming in that's a male, he's kind of like shuffling in, he sits down and he's hand like this, and the wife is like, he's sitting in bed, he's not doing this, he says memory, and I said, look, one of the things you got to keep up with your wife. I mean, look how much energy she's got. You got to keep up with it. You got to stay active. So that's the thing. What I do is I start taking it as memory loss as a symptom, but how are we going to change that? How are we going to change the mindset to feel better? Not, let's prescribe a medication. Like today, I say today because it's fresh in my mind. A patient had a stroke, and he stopped the medications that was preventing him from a stroke. I look at the list. He's taking a medicine for Alzheimer's. The guy's still working. The guy is telling me stories of things that he just recently experienced. His memory's perfect. The doctor that he saw, the neurologist, prescribed the medication based on, he says, you know what? My brain is slowing. Of course. You're 86 years old, He's still, I said, what? You own a logistic company? You go to work every day? You use the computer? You handle your finances? You drive a car? I said, where's the memory loss?
Yeah. I guess another question would be, how do you feel about social media, modern technology, and sleep today?
I mean, great question. And when it also with COVID, so that's why I'm saying, like, I had a whole chapter in my book about COVID because, Zoom was somewhat, there, and it's exploded, and the devices exploded after COVID. And my initial thought growing up without phones and being not on social media was looking at people and like judging them. Look at them, they're on their phone. Oh, they're wasting their brains. Oh, look at this. Then I said to myself, man, you know what? Being a teenager now is so hard. It's like, wait a minute, the phones are here. You're not changing anything. So choice number one, you can be that person and say, oh, cell phones suck, da 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 da. They don't, or you can be like, okay, it's time to adapt. You have to adapt. How do you adapt though? The adaptation requires understanding how your brain and mind works. Because what social media is doing is manipulating your natural circuits, your natural chemicals, in order to achieve a reward. Likes, social comparison, right? Laughter, being on it, the companionship of that phone, it's all there. It's that feeling where that phone is not next to you. It actually makes you more agitated. So the social media itself, to me, is a destruction of the connection, of human connection. So, for instance, sitting in bed with your spouse, less intimacy now because you guys are on social media. Accessibility to cheating, you can now text or Instagram somebody or message somebody, so-and-so. You don't have to work for it. You don't have to go out. There's a lot of things that social media has done that is not good. We can focus on the good, obviously. The key here is to start noticing what it's doing to you. What is it doing to you? When are you grabbing the phone? Why are you grabbing the phone? What are you getting out of the phone? Is it phone allowing you to grow? Are you growing a business because of the phone? Great. Are you doing too much of it? Are you now obsessed with how many subscribers I have, how many likes I have? Look at the comments, because it gets you, because what it's doing, it's going to naturally, the way your chemicals are, it's going to get that reward, that feeling of admiration or acceptance or feeling good based on a like or a comment that makes you feel good. So you're going to seek for it. That's the natural thing. It feels good to be liked. So yes, that is something that we're dealing with now. And now it's also used as a pacifier of like, okay, oh my God, this other, grab the phone and you distract yourself. And when you do that, it comes back at you in full force. It becomes louder and louder and screaming at you because it's telling you, let's go. Something is going on that needs to be fixed, or some question whether it's a survival or whatever it is. So yes, so there's so many to it. Now, the other thing is we're talking about a lot of stuff, is attention. I mean, let's talk about it. How often can you sit through a 3-hour movie? It looks torturous. If you say, let's go to a movie theater and sit for 3 hours. How about character development in a movie? Like, let's get to know the character. You can't do that anymore. How about a YouTube short that used to be 2 hours, now it's an hour, 30 minutes, 20. It's getting smaller and smaller because we are in information overload. It's like overload the information. And just watch people in the elevator. And I have a contest with my nurse practitioners. I actually say, let's be a little creepy. Not in that way, but just no cell phone. Let's just stand next to the person and see what happens, Let's see. Because people don't want interaction. They want the cell phone. And look what they're doing. They're constantly scrolling mindlessly on Instagram. Yeah. So our brains are wired for now inattention. They're wired for now also lack of work. Like, go down the street and pick up some food or cook some food. No, now you got Uber Eats, or you got whatever it is, the delivery system. Or you know what? Let me go to the store and get whatever. No, instant gratification. Now we got same day delivery.
You're right.
So where's the work and gathering? Where's the process? Where's all of that? It's not happening. So we're made to, we're supposed to use energy and burn energy to acquire something. Now we're not. We're sitting on the cell phone. So I can just hit you with so much negativity. Now, What's the positive things? Let's go into a lot of positives. Yeah, social connection, communicating with people you have not communicated with, right? Socially enjoying, let's say, something together. Growing a business, using it as social media. But if you're gonna use social media as the void in your life that needs it, you're in big trouble. Or if you're gonna use social media as a distraction, you're gonna be in big trouble. You're not sleeping at night. You're gonna be coming to my office, or you're gonna be seeing some other doctor, because you're gonna have the inability to learn how your mind and brain works and your body responds naturally itself. Because you talked about how I shut my brain off. Boredom is where creativity develops. Boredom is, I talked about in one of my podcasts, I said, sitting with 4 of my buddies with no cell phone. At that time, we didn't have cell phone. Hanging out on a couch, whatever, or, by the pool, talking about nothing, laughing and hanging out were the best memories of my life. Mm-hmm. As opposed to, look what your brain is doing. You go to a concert, it's learning through now a camera and a lens, right? So your brain is now learning through a camera lens and not gathering that moment. Put the phone down, okay, right? Because what is mindfulness and what's an experience and how it works? It's taking your senses, smell, taste, hearing, vision, getting all of those in there and bringing it all into an experience. And that is a memory. There's a great psychologist, Dr. Kalman, and he wrote the book, he wrote a couple, Think Fast and Slow. It's a very famous book, Daniel Kahneman. Mm-hmm. And he talked about self-memory and self-experience. Self-experience is being in the moment and experiencing the self itself during the moment. Like the concert was amazing. But let's say the concert at the end, say the Coldplay concert, perfect example. So let's say Coldplay concert and it showed that, whatever it is, that cam, your memory now at the end just got lost on the Coldplay concert. I was at that concert it took away the whole experience of being at that Coldplay concert, enjoying Coldplay. And that's what's doing now, is that it's taking it to the self-memory. Some people go on vacation just to hit every museum, and at the end, put on their video, whatever it is, and say I was there. Or go to Europe or whatever. And I just came back from Europe and experiencing it. I went to, I was showing Amanda the concert that I went to, Andrea Bocelli concert. Mm-hmm. And just being in the moment and listening to his voice. And Placido Domingo came out, and just enjoying the moment and feeling it and seeing it and experiencing it. It was just like the self-experience of it with the self-memory, you see? As opposed to just going through the motion and coming back saying you're on vacation, I have the videos, and not really enjoying the moment. And that's the key with the mind, and that's the key with the author, is that you don't want to close your eyes. This is what I see in my practice, okay? You don't want to close your eyes knowing that you spend your whole life with a cell phone and you're 70, 80 years old or whatever age that is, and say, God, I wish I would have done this, or I wish I would have said this to my child, or wish I would have experienced. No, if you take that mind, you actually slow down time. You actually, what they call your flow state, can do 2 options. Flow state can be actually very quick, or actually could be slow down time. Enjoy the moment. Just pause. And this is the metaphor I use, is that take a remote control, and you take the remote control and you can put it in pause, and pause life and slow down, or put it on slow motion. Or you can be like that default mode network, which is on fast forward or on rewind all the time, and predicting and just ruminating about the past and the prediction of the future and all the things you need to do at the office and all of this SHI, whatever. It's all that micro stressors in your life that are all there. And that's where we're going to get into social media, is that social media itself is causing now stressors to develop, and it's feeding on our nervous system. Because what does social media want? They want more dopamine, but they also want you to gravitate towards a story that is something that is going to question uncertainty. So the news is going to want to show you a picture of somebody in a country that's starving of through a war, I'm not going to mention, or whatever it is, or politicize things because it wants you, How about like love America? Like gravitate to being an American, love being an American, of what we have. See, too many of us are in that stuck where they want what they don't have or wish other people have. No. In life, when I see older patients, what you have, focus on what you have. You have your health. Do you have your health? Yes. So that's what you have. You have your health. You have your health. You have your family. You know, you're not have terminal cancer. So enjoy the moment.
Yeah.
And that's a lot of the things that I talk about in my podcast, in my real life, is that it's not, I don't want to say the word easily, but if you learn how our brains work, and this is why I'm so, you know, I want to show how the program works, and how my book is to show through courses and teach doctors how to communicate with patients, is to really understand how the brain works, because we can utilize it and reduce the amount of conditions that we diagnose patients with.
Yeah. We talked about meditation.
Yes.
But I believe you also go into self-hypnosis. What does that look like?
So self-hypnosis is something that I never thought in my whole entire life as a doctor that I would even think about. I was like, so when I went to the conference and they went around asking who they are, and I was like, I'm a neurologist, board certified. I was the only one in the room. I was like, this is pretty cool. Yes, there was a couple of psychiatrists and psychologists, and it happened to be in Disney World.
Okay.
And it hit me, talking about metaphors, is that I was in Orlando. And we went, the park itself, I was like, God, you know, Disney World is hypnosis. I'm like, oh my God. I'm like, wait a minute. I'm like, everything is magical. You walk in there, they have their own police department. Everything is safe and secure. Nothing's happening in Disney. And guess what you can do there? You can open up your imagination. And they use that word like crazy. Imagination. That's hypnosis, imagination. So you're like going there, and people crave Disney. If you look at people, I'm not a craver Disney World. I like it. My son actually is doing an internship there, starting next week. So I look at that and I say, wow, isn't it great to just sit and act like a child and imagine? Because that's what children do. They imagine. They're free to imagine. Their brains are allowed to imagination. And we got to get into that time where our brains are quite to imagine, right? So when I took that course and I sat down, I had open mind, and we learned how to induce a hypnosis. And I was like, there's no way you're hypnotizing me. I'm like, this is probably bullshit. So I said to myself, okay, let's go. And we went into groups, and I sat down, and there was 4 of us, and the instructor's there, who was the head of the whole entire thing. She happened to sit next to me. She's like breathing on top of me. I'm like, I put somebody in hypnosis, and then I was in hypnosis, which I didn't realize it was hypnosis. Now, people think hypnosis is like, you know, clack like a chicken, but it's not. It's not. You know, your early life, 0 to 7, is hypnosis.
It's hypnosis, yeah.
Right. Waking up in the morning and in the shower is hypnosis. Driving your car is hypnosis. You're in the movie, you just know that you're in the movie. You could come out of the movie anytime you want, anytime. So when you're watching one of those thrillers on, let's say, whatever, platform, you're in it, but you know that you're in it. So people think that hypnosis is like that. And actually, that's what I thought. And then I got into hypnosis, and then I was like, whoa, like that critical factor of judging and people looking at you, it's all down. It's relaxation. And that's how you get into your subconscious. Right? So you got to get into your subconscious, because your consciousness is blocking a lot of things during the daytime and all your beliefs. But when you can open that up in your subconscious, so you asked me about meditation. Meditation is not hypnosis. The difference is meditation is really relaxation techniques, but it's not the way Daniel Siegel, one of the Dr. Siegel, says that meditation is more of like a supplement, and hypnosis is more of the antibiotic treatment. So what hypnosis does is you're adding a suggestion, like that aha thing or a suggestion to change it. So like what you were discussing before about noticing, once you're in that, you can actually notice certain things. And the craziest thing about hypnosis is that, so we can talk for hours about the brain, but there's implicit and explicit memory. Implicit memory is memory that is stored in your brain that it can't access it. That's like, so a lot of people don't realize that when you're 7 years old, a lot of stuff you don't remember. So whatever your parent or whatever trauma that you experience can be stuck in there.
And you don't even know what it was.
You don't know what it was. So that's a big deal. And then there's explicit, just memories that you can just bring up. So, And then implicit memory, sometimes you go to like a concert or whatever and you smell something and it triggers a memory, then that's like, whoa, where'd that come from? Because it's stored in the subconscious brain. Your consciousness is like, can bring in 20, 40 bits of information. Your subconscious, 20 million. Mm-hmm. 20 million. So look how powerful your subconscious is. It's just like this library of infinite things going on of your whole entire life. So that's what hypnosis does. Hypnosis is like, okay, we're going into relaxation and we can do something and change it. And it was very interesting because one of the words that I talk about in my practice, and you probably hear all the time, is the word try. I'm trying. Like, so I talk to my patients and the word try comes up. And like Yoda says, there's no trying. It's either doing it or doing it. And you mentioned the word just do it, right? There's the whole Nike commercials and the slogan came through that. Because doing it, right, and trying is different. So when I was messing up, when I was putting someone in self-hypnosis, I was like, I'm trying. She goes, practicing. I'm trying, practicing. And she did it so many times to now, to this day, I do not use the word try. I use the word practicing or doing it or not doing it. And that's it. So when patients, it triggers right away. So I know through that hypnosis that I was doing or what I was in, she plugged in that word try because now my brain pays attention to it. Mm-hmm. So this is a very important part of the whole concept of this is your brain and your mind. You got to learn how it pays attention to things because like we talked about, we're so automatic. If you have no intention and goal, then you really don't have really meaning of your life. Mm. You will have things happen to you and you'll be doing the same thing over and again. So I'm going to give you an example, and I've talked about this, is that if a patient comes to my office, right, and talks to me about their problem, okay, and let's say whatever the problem is, let's say they came in with pins and needles in their extremities, like you did, let's do that. So we acknowledge there's pins and needles, it's a feeling that you have, I acknowledge it's real, we went through the test examination, everything is normal, we did some blood tests, everything is fine. Mm-hmm. Okay, I am not going to do this with you and say, it's all in your head, drink a glass of wine. That's not the right approach. Approach is then to talk about the sympathetic nervous system and all that. So then the question I'm going to ask you is, what is it you want to feel instead? See, so right there, I just opened up an intention or goal, okay? Now, a goal is a goal. A goal can be weight loss, right? But like you said, you can't get weight loss without an intention. An intention is your GPS. So if I didn't know how to get here, right? If I didn't put it on my Google Maps or whatever, I would know how to get here. Just my GPS, I have no idea. Maybe I'll find the streets. You need an intention because your subconscious will start pushing you towards that objective all the time. Mm-hmm. See? So if your goal is pins and needle sensation, what's very common in my practice is like, I don't want to feel that. So if you use the word, I do not want to feel that, your brain lights up what it does not want. Mm-hmm. That's not an intention and goal. I do not want pain. I do not want headaches. I do not want to think of the pink. If I tell you, don't think of the pink elephant in the room, don't think of it. You're going to think of it and think of it. So the word do not lights up. There's studies in functional imaging that lights up certain parts of the brain that will light up the area of the brain that will talk about the not. Mm-hmm. So now I ask, what do you want to feel instead? Well, I want to feel, now, not the symptoms so much. I want to feel calmness, or I want to feel confident, or I want to feel whatever the feeling and sensation is. The way you do that is not only just setting the intention, it's embodying it, and we can get into all that. But the thing is that what I was telling you, what the purpose of that is just, the whole idea is the brain has to need a GPS system of an intention and goal. It has to be very specific too. So you're more in the business too, aspect of it, mm-hmm. right? I'm in the health mind, and I help other people with their businesses if they have questions, is that you need to see what someone who's lost weight, what do they live like? So that's the identity change. So what's your identity? Why don't you go see what Nina does every single day, or your husband does every day? What does he do? Why don't you sit in the gym and sit next to them? Sit them next to breakfast. Sit and see what they do every single day. Because if you don't set the embodiment and the senses into it, you're not going to get it. Nothing will fall. And so in life, you really need to embody it, feel it, sense it, get very specific on your goals and your intention to the T, whatever, and you write it down. because then your brain will start paying attention to it. And it happens all the time. It's like you're talking about, like my wife, like let's say likes Lionel Richie, right? Whatever. So she like loves the concerts. I get dragged into some of those concerts. And I secretly enjoy it. And so we go in and we're talking about Lionel Richie. Then we go in the car, turn it on. Oh, look at that. Lionel Richie's playing. Yeah. Well, 3 songs before was in Lionel Richie. Your brain just paid attention to it because you just set the intention goal and it's in your mindset. You see? So it's not that Lionel Richie came in. And I talk about this story, which talks about how much, when I told you about 20 million subconscious versus 40 bits, I'll tell you the story that brings me chills. And I talk about this story is I was in the morning, got called for a patient having a seizure. And the nurse is like, I gave him this medication, nothing is working. I said, I'm on my way. Actually, I'm 5 minutes away. Let me go see him. Doctor, what are you going to prescribe? I go, no. I got to see. I walk in there and there's like 5 nurses and there's a therapist. And they don't know what to do. And they stop me right here. Doctor, before even talking to the patient, what are you going to prescribe, right? I go, I'm going to prescribe love. I don't even know why I would say that. It's something that it just doesn't really, something that was like a full room of nurses. I said, prescribe love. I'm like, okay, that's interesting. And I said, I saw the movements. I go, these movements don't look like seizures. It's called non-epileptic seizures or pseudo-seizures, usually related to a psychiatric reason. So they show me a video and I look at the video and I'm pulling the video and he's got a tattoo on there. And in Hebrew it says ahava, which is love. I was like, oh my God. I'm like, this is whacked. I said, there's no question that my brain saw it, processed it under the level of consciousness and said the word love. See, and that's what I talk about is that we think we're in real time and our emotions, our choices. Okay. So there's where you can go into like a whole topic on agency and choices. A lot of it is done. We're just in autopilot and the same choices. And you're going to ask yourself, and you see friends all the time, they make the choices and they pick the same partner. And it's like, how did I marry an alcoholic? I just saw a patient last week. I said, she's divorced. I said, yeah, he was an alcoholic. And I go, okay, and was your father an alcoholic? Yeah, he was an alcoholic. I go, and your relationship with your father? Terrible relationship with your father. I said, but you gravitate towards alcohol because it makes you feel comfortable. Yeah. Your subconscious gravitates towards it. Mm-hmm. It sounds crazy, but it's the truth. It's that, yes, if you set your intention, your goal, and your brain only recognizes alcohol because it makes you comfortable, you're going to gravitate towards it. Yep. You're going to pick the same thing over again. So that's where the mind and brain is learning how to author it and say, you know what? Let's start noticing. Things that you're doing is fantastic. It's starting to noticing and changing and learning. And these are all things that people need to start doing as well.
This might be...
Throw it.
Okay.
Let's go.
How can somebody, or how can people today with traditional medicine, I can go down the path of now, go find someone else outside of the system, right?
Sure.
But then we come across issues of, do they accept insurance and expensive and all that?
Sure.
So right now, with what people have available to them, how can they have these deep discussions with their doctors without alienating their doctors?
Right. So
because not everyone is like you.
Right. Exactly. And not everyone can do that because a psychiatrist, for instance, they don't really run tests in their office, right? So there's a money-driven approach to testing because you make money revenue. So what does a psychiatrist need to do? They need to see volumes of patients and they have expenses. So do I fault a psychiatrist for doing that? Not really, because how are they going to keep their business? They'll make nothing. They'll make no money. I'm a big advocate of psychiatrists need to make the most money. Mm-hmm. They need to make most money per fee as opposed to a surgeon. They may get paid for the surgery, not for a follow-up. All follow-ups are equal the same. But also doctors were not trained to do what I'm doing. I'm not trained for it. I was not. I would never have this conversation with you 15, 20 years ago. I could not believe I'm sitting here doing this because I really don't as a neurologist, I thought I knew how the brain works. And if you look at it, I'm like, yeah, the brain works so structural, like the brain, and a diagnosis, and I can diagnose. What does a neurologist see? We can go through a whole list: Alzheimer's, Parkinson's, MS, myasthenia gravis, ALS, migraines, carpal tunnel, neck pain, back pain, jaw pain, neuropathy. I can go on and on and on. So many people see me for so many different things. It's amazing how many people actually see a neurologist. But as a neurologist, I'm trained, because I did an extra fellowship, I'm trained for the peripheral anatomy too, so I do head to toe, and more a holistic approach or integrative approach. But then I also backed up and say, okay, I learned this way, how to change it. Now the model system, to get back into it, you're going to ask me how to change it, and that's what I would love to do, is really teach doctors how to communicate with their patients and make them feel better, and listen to them. The value system right now is not there. Then again, how about the doctor itself maybe not spending so much time, right? Like the way I say it.
Yeah.
But how about for prevention? How many times do you see a cardiologist or general doctor say, you know what are the omega-3 and 6s that I can go through as far as inflammation and diet? You know, what is it? You know, gluten is not working for me. What can else work for me? You know, what kind of diet can I do, right? Exercise, you know, how do I exercise? Can you imagine asking your doctor? The doctor should know high intensity exercising, or should know what's good for you, walking or jogging, yoga, stretching, whatever it is, Pilates. Get into the exercise program and write it down. Dancing, movement, whatever it is, because it is so important that the doctor should know that.
Yeah. Because
that will reduce the visits to the hospital and make people feel better.
Yeah. Do you think that this integrative approach will ever become mainstream?
I'm hopeful for it. It's my mission is really to get into psychiatrist, psychologist, and just learning. I really want to teach parents. That's my goal.
It starts at home.
At home. So I really want to get to that age groups as well and really teach that, because what's happening now is the information overload and the amount of other things that parents are forced to do.
Yeah.
They are spending less time really with their child. They're overloading them with activities and soccer. And then if I'm not at soccer, mom X is at soccer, make you feel bad that you're not at soccer. And there's this whole social comparison. So you have to be at soccer. You know what? How about mom woke up, packed lunches? Maybe mom is a single mom that actually went to work all day and then comes home, takes their kid. Let her actually have time for herself. Mm-hmm. But you know, or just parents just not caring and letting the school system do it. And so it's becoming a big problem. And I'm seeing in the office, and it's just, I mean, there's not a day that I go by, and it's not like my practice is full of people that are anxious and depressed or have OCD or whatever the title, and you know, it's everything. It's everything. And even if a patient comes in with a stroke, let's say, mm-hmm. like I had a woman I took care of who had a stroke. She lost her language, and she lost her husband recently, and she has a condition called atrial fibrillation, and we actually pulled the clot out. Her goal in life, actually at 86, was she'd go on cruises with her husband, but she also was a speaker about longevity at these cruises. So it was like amazing. And so she lost her language, so she got that back. And then having her come into the office and then talking to her, not just like, okay, here's a medicine for prevention, take it, make sure you'll never have a stroke. Mm-hmm. No, I got into those details. You know, so happens she lost her husband 2 months before that and she had a stroke. You know, stress causes inflammation, causes activity. It flares it up. It's not the sole reason. It turns those genes on.
Yeah. Like when Bruce Lipton talks about that, and so does Dispenza, and doctors particularly say, the first thing they say is, any history in your family?
Right.
You know, what is this? And then immediately they jump to that. And my take on it is, correct me if I'm wrong, my take on it is, no, we all have predispositions to certain genes. Like maybe you have cancer and maybe I have diabetes. If you're stressing to a certain level, your cancer gene might turn on. For me, I might have the same stress as you, but my diabetes gene will turn on. And then people are like, yeah, that you're good. The issue is people are assuming that they're going to get the thing that their parents have or their grandparents have. Well, now you're already putting fear into people, right? When that's not the case. The case is that you can control what you eat, how you sleep, how you exercise, and how your brain works and how you process your emotions.
Beautiful.
At the end of the day.
Well said.
Right?
Well said. And that's exactly right. I have patients that come in and say, look, I have a family history of stroke. I don't want to get a stroke. And I go, look at you. Do you look like your mother? No, my mother was obese and she smoked or she had diabetes. I said, are you eating healthy? Yes. I said, okay, so it's not hereditary. Alzheimer's. Yes, I had one parent that had Alzheimer's. Yes, so there's these new genetic testing now I said, genetics may load the gun, mm-hmm. right? But lifestyle triggers.
Yes.
So.
And most of us mimic our parents
lifestyle.
habits, right? Sometimes, and people don't think about this,
Right.
but sometimes we mimic how our parents reacted to financial stressors. Now we're 20 and 30 and we're reacting the same way and we don't even know it. We might be eating the same kinds of foods. We might have the same viewpoint on exercise or no exercise. And that's where you start to see these things occur generation after generation.
You said it perfectly, and I agree with you, and that's exactly right. And that's what's told.
Yeah.
That's what doctors are telling people, and that's what the media is telling people, and that's all what it is. And it's over and over again, the same story over again. And that's why I'm coming out on social media. It's like, I had enough already. I was telling my wife, I'm watching people on social media, and they're talking about health, and there's always like a gimmick of what they're doing, like, and what they're saying as far as what it is that they're enticing people for, and whatever that is. And I'm like, look, I'm doing this because I see this every single day, and it's like, where's the supplement? No, there's not. What am I selling? Because I'm getting people text me, what are you selling? Yeah. I'm going to sell a book. I'm going to sell a program. Yeah, okay, fine. I'm not selling anything else than that. And it's everything is what I've experienced in my practice. And you get it, and you know, and some people don't get it, and you know, that's the problem, is that the people that don't get it are typically have a lot of pre-programs, and they don't see the light of the tunnel. They are constantly stuck in their brain, not in their mind.
If you could redesign medical education, medical school, pre-med, what would it look like?
So now we're in the field of medicine that's changing right in front of my eyes on ChatGPT and artificial intelligence. And it's a great tool, though it has now replaced stethoscopes and the quality of a lot of things. My residents that are rotating with me, I tell them, do not turn that cell phone. If you say, I don't know, that's how your brain learns, when you don't know. Mm-hmm. And also, sometimes when you felt bad, you don't know, you'll never forget it, or you won't forget it. The diagnosis of rapidly putting things in and spitting out can help. Yes, it's a tool. I use AI. I do. I use AI for writing, and I use AI as a tool. It's a tool to put things grammatically correct and help me out. But it's not going to a tool to make a decision. And also, besides that, it's you and I are sitting, the empathy, the connection. So a psychologist now, or psychiatrists, or even doctors, and it's funny because as a doctor, I only do a few telemedicine. I don't want to do it. You know, I just, the connection is so off to me. Yes, efficiently, I can just nail more, patients. I want the patient in the room. I want to not touch the patient, but you don't understand that there's two types of language and communication. The words you use are so powerful. The body language, the tone of the voice, the eye contact, the language, the movement, all of that is under your consciousness. It's your subconscious. That's how you connect with somebody. That's how you actually get in there. That's how you actually help a patient. You can't get that there. And I'm very up to date on neurology. I'll walk in, I can nail a differential diagnosis like no tomorrow, on things like this. Because then I can get into nerdy neurology. And that's what I have my colleagues for. Nerd it out, let's do it. And go to the conferences. But it's important to scale back and be like, this is a person. This is not a sheet of paper that they filled out. Because what happens is, now I'm at a point of my practice that I'm seeing second, third opinions. Mm-hmm. The patient's coming in with records like this, and they're ready to roll it out. First thing I say is, we got this. I said, we got this. I said, take your time. I'm not in a rush. You're not feeling well. You got records. I don't really want to look at the records. I don't want to have a judgment. I want to hear what you have to say. And then the records, we can go through it later. Just tell me and just get it out and go and go and go and just let it go. Let it go. In Miami, which I'm sure you've gone through this in your eyes. It's
yeah.
You can tell me what kind of car you drive, or you can tell me how much money you make. That doesn't impress me at all. Mm-hmm. You know what impresses me? Impresses me is, tell me what you're feeling. Tell me how you got there. Tell me your story. Tell me your habits. Tell me where you come from. Tell me something. Tell me something that's exciting. Yeah. Because that material stuff.
Tell me something real.
Tell me something real. Tell me something real, because external stuff and internal stuff when they don't match together, that's it.
What are the most powerful daily habits that people can adapt and turn into habits for themselves to make their brain health more optimal as they age?
So when we talk about habits, habits are done on the level of consciousness and subconscious processing and subconscious behaviors. And to me, everything is a habit. And then we say, what do you mean everything's a habit? Well, so the 5 pillars of health, I don't know if I described it, but the 5th pillar is going to be, we're going to go backwards, is physical health and longevity, quality of life. That's the one that the patients are coming to see me and help me. The pillar above that is sleep. Above that is exercise. And above that is diet or nutrition. And then above that, which is the foundation, is mind health and brain health. So the habit itself is going to be with brain health. Now, when you say brain health, it's mind health, it's brain health, it's emotional health. It's everything is in one. Mindset, your beliefs, everything's together. Now, the way you habitually think, the way you habitually worry, the habitually you have anxiety, the way you habitually do things, it's all habits. So the key is to break down individually what are the adaptive habits and what are the maladaptive habits. What are the habits that are harming you? So obviously like smoking, overeating, poor health choices, and so, all of that. So what do I see that's a healthy habit is basically a healthy mind, right? So people that really are mindful, people that notice, people that are going to, in their daily life, become noticing and changing things over time. People who have control over their brain and changing over time. Now, this is very non-specific, right? So again, now, what are the things that you can supplement is like learning, things that make you feel good or things that are beneficial. So it's a very, when I talk about habits, it's really breaking it down into that circuit of stimulus. And then the second part is the action behavior and then the reward and then going through it individually. But what do my patients do? If they have good habits, then diet and exercise. Now, so here's the thing, right? So I talked about a little bit before is that you have people that exercise and look so fantastic on their body. So that's that, okay, right? But that's their body book cover, right? Okay. But those people are struggling with a lot of other things inside of them. They're getting sick more often, even though they exercise.
Yep.
They develop certain conditions because they exercise.
Yep.
So I have so many of my patients be like, I run every day, I exercise every day, I eat healthy every day. So why is my stomach off?
Yep.
And so I'm like, okay, let's break it down again. Because if your foundation is not there, exercise, diet, and sleep are not there. So the thing is, when you get into the gym, the part about being a habit, and even it's talked about in the book on Atomic Habits, is like change the identity. It's like you go to the gym, you're not going to the gym to no. You go to the gym because you're an athlete, not somebody who's paid for a trainer or somebody who wants to lose weight. How are you going to, you're not going to, no. I'm walking in that gym because I'm an athlete. I'm going to bring it. Mm-hmm. That's the mindset. So that's the mindset. Now you can work out, right? I can sleep at night. Oh, I've been sleeping. I can never sleep at night. I'm an insomniac. I can't sleep at night. I've never been a good sleeper. You're ready. You're never going to sleep. What's your intention? What your goal? No, I'm a sleeper. I love sleeping. Right. So you can't line up any of those pillars without that foundation. So the habits are eating is a habit, right?
Yep.
Exercise is a habit, right? And sleep is a habit.
You begin to tell a new story.
Yes.
Tell yourself a new story.
Exactly. So that's part of the story, right? So your brain is the story. So changing your brain is changing the story. Mm-hmm. Because all of our story does end with death, right?
Can't escape.
And how many times do I ask patients? How many patients I've seen? Thousands. And I ask them what they're afraid of. Claustrophobia, spiders, I don't know. Medicines, doctors, who knows, right? How many tell me death? None. Very rarely.
Mm-hmm.
I think that should be the number one thing. I'm
Really?
afraid of dying. Yeah, I feel so. See, that,
Do you fear death?
I fear death, yes. Because I don't know what happens afterwards.
I don't fear death.
See, that's good.
Because I feel like my consciousness will still go on. I don't know scientifically. Please
Yes.
don't, I'm not saying this scientifically, but I feel like my soul, my consciousness is forever, and I'm going to go off maybe onto a new experience or nothing. I don't know. That gets religious now, right? But it doesn't scare me because I feel like it's a new journey.
That's good. That's a good experience.
It's like a new experience.
I fear death, and that's what I fear. Now, all those little fears and stuff like that, that's what, because I see in my practice when someone is in a coma and I see their brainwave EEG flat,
Yeah.
right? And they're all under anesthesia. Where is it going, right?
Yeah.
But think about it this way, on the other way, is let's say I said to you, you have no time cap. that say life you can live infinitely, right? How would we survive? We wouldn't actually. We survive and we live because we know that there's death. Everything we do. If you knew that you're never going to die, you don't even need to take care of yourself.
So I think emotionally
Yes.
that would be a mind, blank.
Yes. Yes.
For sure.
Yes.
But also maybe that's because I've spent the last 37 years knowing that I'm going to die someday, and that's the norm. Now all of a sudden you come to me and say you're going to live forever, and now I'm like, what? So that might be scary.
Yes.
But if that just is a part of somebody's reality from the day they were born, like that was their programming, hey, you're never going to die.
Well,
by the way, that's like something that's never happened, right? No one's ever actually tested that.
So I've asked a patient. I had one guy I saw a few months ago, and he was at the airport, and he went into cardiac arrest, and he got resuscitated. And so and he had a stroke after like a few days afterwards. And great guy. And he comments on my suits. He wears suits. See, that's the connection with the patients, and he's.
Yeah, I will never have that.
So then I asked him. I said to him, okay, so what was it like? It's like, what? I go, did you see a light? Was it black? It's dark, nothing. He says, I woke up, I was in the hospital. I go, give me something,
Yeah.
So that's so, I don't know. I don't know if it's just like that and it's over. So yes, faith, and I'm not going to take that away from anybody, right? If you're whatever religion you have, whatever faith you have, whatever, that's fine. Mm-hmm. What I do have a problem with is if you are bringing yourself down, you're harming yourself down with all the things we've talked about, or bringing other people down. That's the problem that I have. And, this is the world we're living at. And it's based on our wiring of our brain and mind.
I was watching something the other day, and it was showing how there's studies coming out now that when someone passes away, about to pass away, there's movement in your brain, but the way that the brain starts to fire shows you that there's a consciousness, and like I don't know how they're measuring this, but that people hear something specific before they pass away. Do you know anything about this?
So I don't know about the exact study, but there is what they call studies that they're using transmagnetic stimulation and EEG on studies that have patients that are considered, let's say, brain death, mm-hmm. or have what they call an injury to the brain. So remember, death in the state of Florida is cardiac death, and then there's brain death. So you can actually have your heart beating and the brain is not working, or when we do an examination. So this is where I unfortunately have to, you took a deep breath, mm-hmm. there. So death is scary. Yes, those are tough conversations I have a lot with patients and myself. And the way I view that, let's say a family member, I had a young patient who hung herself in a terrible situation, suffered terrible anxiety, and had a terrible childhood, and went to doctors, asked for help, went through the whole system, and big social influencer, was gaining all of the feelings and the rewards based on social media. Her activity of the brain was absent. So you have to have this talk now with family. Sorry, not absent, I'm sorry. Because there's two ways. One is absent, it eventually led to it. But the first part is irreversible injury. So as a neurologist, there's a way to examine the patient by looking at their pupils and their eye movements and their state of comatose state and what they call the cranial nerve examination. So it's the whole thing. And then there's tests we can do, MRI and stuff like that. And then there's these movements the patients have. So I don't want to get into all of that. So the discussion is that I had to discuss that to the families, that she's not going to live a meaningful life and not have a recovery. She could possibly be vegetative. So my approach in the beginning was like, as a doctor, was like, not going to be, she's this and this. I've never seen somebody wake up, or right there. So now my approach is so different. It's like comforting in a way. I know it's an uncomfortable situation. It says, look, as a neurologist, I've examined, and this is what we see. And unfortunately, based on my experience, then this is what it is, right? I am not going to take away your hope. I am not going to take your faith in religion. I am not going to take away what she wanted either, if there was a will or whatever it is. Because doctors have that, they like pulling these things from people. And I see it all the time in the hospital. So I am more of an approach, I stand back. But as a doctor, I have to be a doctor. I have to be somebody that is this is what I do, right? Being involved with all of that and the conversation of brain death and also irreversible brain injury is very difficult for me. And this is where I see, when you were asking about activity of the brain, it's so hard because so what they do is they'll put sensors in and stimulate and see whether there's auditory centers of the brain are being triggered. And so it's difficult to see. But again, what's consciousness, right? Consciousness is a stream of consciousness, is like all of these networks connected in one. All your senses all coming together. It's like a whole orchestra playing together. It's not just the violinist, or like a certain part. Let's say. So it's a whole thing. And so when I see that, I'm like, man, what is it afterwards? What's going on afterwards? But then we talk about, like, we just had this talk with the pulmonologist in COVID, we had the craziest survivals of people that look like they'll never make it. And the doctor was saying that he feels that the patient has love in their life, like the family being there every single day, and someone who they care for inside of them keeps them alive. There's something on the healthy mind that we talked about that is giving that person purpose. Something. We know what it is, but it's something, because we saw it in those people that came out of it. And those people have these stories, and how they survived the COVID pandemic. And so there's a lot of things in science that we understand, and a lot of science that we don't understand. So as you can see, a lot of it we don't understand.
Yeah. Can you be born with ADHD, or is it something that's developed over time?
So there are some genetic components of what they call ADHD, or ADD. The H is the hyperactivity word. There is a stereotype, and there's overdiagnosis. And now what we discussed before, that our brains are now being wired for inattention. Some people now, what's happening is, in the practice, that a lot of people are having difficulty with concentration. I kind of look at it as a task manager on your computer. Like, you hit that button and all these programs are, and you're like, everything, you got to start, like, for the memory to work, you got to eliminate each one.
Start closing the tabs.
Closing the tabs. So a lot of people have brain fog or feel they have inattention because their brain is wired with so much stuff, of information overload, of things and stressors and all of these things. So is it overdiagnosis? Yes. Are those patients can get a stimulant and make them feel better? Yes. Is it an advantage to be on a stimulant? Yes. That's why it's banned in athletes and so and so. Now let's go back to hereditary component. Well, we don't really know. We do know that foods, definitely sugary foods and processed foods, definitely is part of that, right? Sometimes if a parent gave that person inattention, that could be part of that. They learned from their parents to be inattentive, downloaded that program. So maybe that's part of it. Again, the genetics are there, lifestyles. Now, it happens so young. So if you look at an ADHD brain, it's very different. So if you catch it early, ADHD is not just attention. ADHD is executive function, which means is all these functions in the prefrontal cortex, which is going to be understanding time management, emotional regulation, self-control, self-awareness. See, those are all things in this prefrontal lobe. It's not just ADHD. ADHD, just having concentration and memory loss of some things, is not diagnosis. So you got to really get into those things. And if you catch it early on, then there are ways to teach the brain to learn differently. Now, what's going on in the world today and society is that our schools are strict now, and they want you to learn these subjects, and you're told, as your belief, that you need to be good at everything. But you know what? If you have ADHD, let's say, you only really your brain, the way it's wired, is it's going to gravitate towards what you love and you get motivated. Actually, ADHD people, if you put them on a deadline, can work so fast because they have a deadline. That's why they work small in breaks. Now, society says ADHD, look, your kid, fix it. Fix it? I don't think you can fix it. See, no, you fix it, school. Meaning, why don't you allow the kid to sit on the floor?
Yeah.
Why don't you allow him to make him feel good, and maybe teach him more self-awareness, emotional regulation, pre-program the brain. Instead of, this person has a problem, medicate them, and so on.
Already alienating them and
All
telling
of
them
it.
something's wrong with them.
Because you know what? ADHD is an advantage sometimes. Coming from experience of family members that have it, who has trouble sitting in school, is amazing in social life, can kill it, who's going to be so successful in life. So do I tell that person, sit down, don't be on your, pay attention? No, he has struggles doing it. So make him feel good. Make him feel good, positive about it.
Yeah.
But you see what I'm doing here?
Yes.
Is the mindset of positivity and changing the typical nonsense that the world and the beliefs are doing, because that's exactly what's mandated. And a lot of people just do the same thing over and again, and the schools do that. So ADHD, we could talk obviously a whole episode on ADHD. I plan to do that as well. The thing is that really breaking down the brain itself and then using the mind and tools like meditation, slowing down all of that, taking breaks and working with your brain, because the brain matures differently with someone ADHD. It's well known.
Yeah.
So
I've had my fair take of meditation. So I do meditate every single day, but there are months where I fall off the wagon a little bit. I can tell. I can immediately tell in my sleep. I can tell how I'm handling interactions with other people, how I'm handling conflict. It's very apparent to me. And the minute I go back to, I only open this 3 times a day and I meditate morning and night, I handle things much differently. And I wish that people could understand what a great tool meditation is. That truly, if you give it time, like once I did, I went 3 years meditating every single day. So I have my base set. It doesn't have to be 3 years, but I know what I'm going back to. I know that feeling and I know the results that I get from it. And a lot of people are like, I just can't quiet my mind. I don't look at it as quieting your mind. I look at it as relaxing.
that's right. That's very good. But you're also doing so many things. You're interpreting it, you're bringing meaning to it, and you're understanding what it does for you.
Yeah.
And that's what's important about that. Now, what you're also doing is you're very much in tune with your mood. See, our mood fluctuates all day long. That mood goes up and down, and it could be hormonal, it could be lack of sleep, it could be food, it could be so many things. Like right now I haven't eaten, so yes, my mood is a little different, right? Mm-hmm. So the key though is to know when you're agitated. So I have a way to, like talking about metaphors, I teach my patients, and I love talking about how we're like a barometer, and our barometer should be in the middle. It's a balance, and it fluctuates based on your mood. And let's say the 10 is the cooker pressure where it explodes, and the 0 is too calm. You don't want to be too calm, right? You like to be calm. So I give an example of a patient comes into my office and is late and wakes up, and it's like, oh my God, Dr. Resnick, I have an appointment at 9 a.m. and it's like 10, or 9, let's say. I can't get there. And then it gets coffee, spills it on their shirt, goes into the car, it's traffic, gets into the front of my office, and there's a million people. Mm-hmm. That person is not going to be like, how long's the wait? 2 hours? 2 hours? Sure. Why not? No, you're going to be exploding, and who knows, right? So the key real is like, okay, that's life. Let's break it down. Okay, call. Dr. Resnick, I'm running late. Can we do it at 11? Sure, okay. Spill coffee, let's say, okay, let's put on a pretty blouse. Let's just change. In the car with traffic, you know what? Put on a podcast, something I enjoy. Bringing it down. Constantly bringing it down. Yes, being aware.
Yep.
Because once you get to a 10, it's like a little 2-year-old kids, and you see that all the time, kicking and screaming and being in their mood.
Yeah.
So you're bringing down the barometer over again.
Yeah.
And I did that because in the hypnosis course, it was pretty funny. They were asking, what is your perfect day? And there was like mountains and hiking and all this thing and whatever, picnic and all that stuff. They looked at me, I'm like, what's my perfect day? I would like to have perfect day every day. I said, coming home happy, satisfied. They're like, what? Yeah, coming home happy. Because I used to come home in a bad mood, stressed out, just like upset, stomach's off. It was just like a constant feeling of just emptiness or whatever it is. It just irritated. So my mood is, and beating with my kids. So the mood is bringing it down. So when I get home, I'm at a 0-1, ready to hit the gym or whatever I want to do, and being in that mood. So my target, my intention, my plan on that barometer is set.
Get somewhere else. Consciousness, man. I am so intrigued by consciousness.
Take it.
Like, I don't know if you saw this movie. I'm blanking on it, where they took the consciousness out of the brain and put it into, because he didn't want to die.
Yeah.
it was an older guy, and he was obsessed with living forever.
Okay. Oh, we talked about that.
Yes, and he had tons of...
Like that guy Johnson. I don't know if you guys follow that guy.
Oh my God, Brian Johnson. We can go there too. Yeah, we can go there too.
Okay, guys. Yeah.
So in the movie, they take consciousness out of a younger person's brain and put it into this older guy's brain who's very successful, wealthy, and can afford all these things, right? Because he wants to live on forever. And if you research this and Google this, they're doing studies on this. Like, can we take a younger person's brain, put it in an older brain, and make them live forever? But my opinion of consciousness is not that it is physically coming from the brain. My belief is that consciousness is something outside of us, and we are receivers of it in our brain. And when your time comes to go, you're gonna go. You're not gonna be able to stick another consciousness in there.
Do you want to switch seats? Because you did a beautiful job right there.
Really?
Yes, beautiful. The way you described it, you sound like a neurologist.
I don't know.
Oh my God, if the consciousness is so much, like as far as understanding, look, you can't transplant the brain. You can't put a brain and just attach it to the spinal cord. It just doesn't happen. Yes, there's these new things, new devices that are going to be there. You can't live forever with consciousness. I guess if you talk about reality and things like that. See, the thing is, you're interested in consciousness. See, and that's what I was trained for, is waking patients up, understanding consciousness, and making diagnosis of consciousness. I am so interested and obsessed with subconsciousness because that's the infinite power. William James said the power is through the subconscious. It's just so powerful in understanding of it, because if 5% of our life and decisions and all that is consciousness, 95% is subconsciousness. So yes, we can focus on consciousness because consciousness will allow us to be consciously aware. You can't be conscious all the time. Your brain needs to go in subconscious mode because of fuel, energy, efficiency, right? Because that's how it works. So I love to go into the programming of the brain and start changing it over, through the habits, through self-hypnosis, through different things, and even people talking about it. I'm a medical doctor. I'm not going to talk about psychedelics, but psychedelics itself has a role in the future of opening up your subconscious into things that you can't get into. So that might play a role. The only problem with psychedelics, you have to be careful as far as that, is that, again, psychedelics are being used as like someone in their house or some doctors that are doing these clinics and just checkboxing without a specific intention, goal, and so and so. I
have been down that path, not medically though.
Okay.
And this is like 10 years ago. And I have experienced those 8-9 hours of limitlessness. Like you ever see the movie Limitless?
Yes.
That's like what it was like,
yes.
Except because my set and tone and stage was very calm in my home in St. Louis. I have experienced that, and it was exactly how I have always visioned it to be. Now you can go into, was it a self-prophecy then? You saw what I was feeding my brain when I wasn't even doing this stuff before, right? But it does make you think what you just said. We don't use our mind to its fullest capacity. We only use a couple % of our brain. And that when you do go through an experience like that, and I'm saying this because you said as a doctor, like, you can't go there, right? It has the ability to show a person like you and I, when you experience something like that, that I truly do have more control over my brain than I think I do in my day-to-day life.
Absolutely.
And it's actually so simple as I can turn this light on by thinking about it. I know that sounds crazy, but if I experienced that and saw that, I don't know if a person in the room who didn't do LSD could see the light going on and off the way that I could. That's my reality, right? And now we are going into a whole different realm of subconscious mind, creating your own reality, right? Your life is how you're making it, all that stuff. The question still comes to me as in like, why is the medical system against us seeing that in ourselves? I find it to be empowering.
Well, the medical system, you do have scientific research. And again, what do you think about who's doing the research, right? Pharmaceuticals. So pharmaceuticals are pointing towards certain drug companies, and I don't think drug companies do have, besides ketamine and things like that, they don't have a big role on those, because believe it or not, those are cheap to make. So pharmaceuticals really are geared towards studies and things like that. I definitely am open to learning about it, not to really administer my patients, but learning about stories, because I've spoken to a lot of my patients that have healed in certain ways based on that.
Yeah.
But the way they healed on it was looking at the subconscious programming.
Absolutely.
And going through there.
Absolutely.
And getting into that. Now, consciousness, back to that, is, I read a great article in a neurologist that talked about consciousness as a memory system. So our stored memories. So basically everything we've learned in our stored memories is basically consciousness of projection. And so we are basically fractions of a second behind reality. So that's with emotions and everything. So consciousness as a memory system makes complete sense. And that Dr. Kahneman actually put those into two systems. System 1 and System 2. One system acts subconsciously, and the other system is the slower system, acts more with the mind and brain. So, the prefrontal cortex. But you said a very important point, is that the mind is a process. It's the controller. It's the spiritual, whatever you want to say, it's that area there that is going to be able to decide on what it wants to pay attention to and what it wants to. And that's your author, right? You are in control of your authorship of your book. And that's how you do it, through consciousness. And the fact that you're doing this, and understanding this is great. I mean, because that's how you become successful. Now, when you talk about success, I'm not talking about finances.
No,
I'm talking about success as far as having meaning and purpose in life.
Yeah, feeling fulfilled.
Fulfilled.
Knowing your intentions, knowing where you're going in life, what it is that you want to do,
Right.
Just the simple of like knowing what makes you fulfilled. Forget happiness is cheap, in my opinion, right? Like anything, I could go buy something and it makes me happy for 2 minutes. That's what I see happiness as. But feeling fulfilled, but we live in modern society, and you have to figure out a way how you do that without letting everything bog you down or become reactive, so to speak. But I agree with you on the programming. So I just got into hypnotherapy. I go to somebody here in Coral Gables, and I'm on session 2 of 8. And all I can tell you is, why did I wait so long to go? I think it's incredible. She told me, she's the one who told me that I'm in growth. She's like, you are like very much about growing and this and that. And then she's like, I think it'll be very easy for you to fall into hypnosis, right? She's like, you meditate, you do this. I'm out. Yeah. Like to a point where I don't even know what she was saying. She's recording everything so I can listen to it afterwards. All I know is when I get out of the last 2 sessions, I just felt nothing physical. I mean, definitely relaxed and well rested, but almost like I wasn't thinking. Yeah. That's what it was. Yeah. I literally was not thinking of what I have to do, rush home, take the dogs out, do this. No,
so it's called a critical factor.
Just going.
So in the hypnosis world, I'm just going to use their terminology, it's called critical factor. Bypassing the critical factor, the analyzing rational mind is now, the consciousness is out. That's the subconscious. So now you get into the programs, the habits, the changing, the rewiring.
Yeah.
But there's guided, and there's ways to do it on your own. So that's why my program is going to learn how to do it on your own, because we're in hypnosis on and off through the day. And then there's times where you can meditate, and then yes, you can write your script, or you can listen to it, or you can feel it. The words that she's going to use are so powerful. They're power words. Those are the words. And if you look at them, they're like imagine, notice, magnify. Just there's certain things that you just use in your vocabulary, which I use in my practice, to really help patients. Not that I put them in hypnosis or manipulate them. I just want to allow them to see that I'm listening and use words that will change them overall.
Yeah.
So I'm glad that you've decided to do that. It's just that a lot of people just, again, with the beliefs, just all these hypnosis are quacks or whatever it is. Now, you have to be careful because some can be, obviously.
I was going to say, you have to do your due diligence.
You got to do your research.
Yeah.
You got to feel comfortable. You got to have an intention and goal. That's why they'll ask you, what do you want to change today?
Yep.
Or what is your goal? What do you want to do? Make you feel comfortable and get there.
Yeah.
You're not going to walk out and just like as a robot and do something.
No, it's not like a woo thing at all.
No.
That's not, I felt it, if I could compare it to something, it was a deeper meditation in some ways, but like she showed me without me even asking her some real time things.
And the amazing thing is, I'll tell you what, it's amazing. I'm sure they ask you, how long was I in trance?
Yeah.
Hour, 10 minutes, 5 minutes, 4 minutes, 2 minutes.
Time just
stops. Slows. That's
like,
right.
There are moments you come out. The second session I came out of it and I was like, I forgot where I was, and I thought I was there for days at one point. And she's like, take your time. Take your time. She's like, she told me, she's like, you're one of my best ones. You really just let go and like go into it. But she did do this one thing. The one day I came in and I was constantly yawning for some reason, right? And she's like, your nervous system is doing something right now. And I was like, yeah, I don't know. And I was ignoring it. And she goes, okay. After I got out of my thing, I even forgot that she asked me that question because that's not why I'm there. I'm there for another thing. And she goes, by the way, as I'm walking out the door, she goes, did you notice you're not yawning anymore? And I was like, yeah, but I don't know. She's like, listen to the tape because she records everything and sends it to me. And I didn't yawn the rest of the day.
Yeah.
Like she catches things that are like you're showing or showcasing and so, she like changes them.
Well, a lot of times also, that's what I'm telling you, is that 5% is consciousness, 95% subconscious.
Subconscious.
It could have been yawning, it could not have been consciousness, whatever it is, you could change it.
Yeah.
That's the thing is, I drove here. Do you think I even know how I got here? Really? I was following maps. I got here. Someone took me here.
Yeah.
And so wait, you're driving the car and thinking at the same time. How do you do that? How do you flip the switch on both? So people have to understand that our subconscious behaviors and programs, and this is why I'm fascinated with it, is 95%. I focus on that. Let's focus on your 95%. Let's focus on that. And then get that consciousness available where you can use it. So let me give you an example. Like people spend their times like in the morning changing outfits and what to eat. And it's like, you're burning fuel right there, autopilot. Boom, 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 boom. So when I get to work, my brain is ready to go. It's conserved energy. It's ready to use it at the right time, right? So that's kind of like the way your fuel system works and things like that. So yeah, that's pretty cool that you decided to do that and you were open about it. But people need to know. Now, am I advocating for everything? No, but it's very important to get a golden intention but that's a good way to get into the subconscious brain.
Yeah. I think the people who achieve the impossible, I think it is because they know how to tap into the 95. Don't you agree? Into their subconscious mind?
Of course. I mean, people that are successful are the ones that are challenging their beliefs.
Athletes. Cristiano Ronaldo is someone that comes to my mind right now. Like that guy, if you ever watch his documentaries or watch him speak.
Okay.
Yes, he's surrounded by the best of the best nutritionists, the best trainers, the people who are telling him, yes, you can, yes, you can. He knows who to surround himself with, always has. But he taps into that mind, not the front.
Right. So one of my favorite athletes is, I'm a tennis player, so Djokovic.
Okay.
And Djokovic struggled in the beginning when he started playing tennis. Yes, he had some gluten condition, and yes, he had some insensitivity, so. Yes, he took care of his body, he's stretching, he's more mobile. He hired all of the things that athletes do, but he practices exactly this, meditation. He really does some form of self-hypnosis. He uses his mindset, like he says, like pressure is a privilege. His competition, he takes it and uses it to his advantage. So in life, the key is really, like you said, is that it's really understanding how the mind and brain work. It's rewiring it correctly for whatever that goal achievement is that you want in life.
Yeah. Where can people connect with you, find you, and watch your show? And also be on the lookout for your book.
I'm very excited that the book is moving. I've changed it like 6 times, believe it or not. So the book is going to be either Your Healthy Mind or The Healthy Mind, and it's going to talk about author, story, and book itself, and use the metaphor. So I'm hoping it's going to be ready by the end of the year. You can find me on YouTube, The Healthy Mind, or Dr. Steven with a V, Resnick, Resnick. I'm also on Instagram and Facebook. Also, I'm a practitioner, a neurologist in a local hospital. You can find me there. I have been hit up a lot. You have to understand that there's time and places for certain things. But I'm very excited that you, number one, allowed me to voice what I feel is important. I think a lot of people are gravitating towards. A lot of people have enjoyed my content so much. And what really hit me is when my patients started taking papers from my office of what I wrote down and the content and told me that I should be on social media. And somebody who was never wanting to be on social media, I'm totally under the radar. I was like, you know what, it's time to because helping one person in my office, 2 people in my office, I'd rather help thousands, millions, and then doctors. So now I'm just really it's time to move bigger.
That's the positives of social
It's a
media,
positive.
right? Because trust me, I don't like doing this either. I don't like being on there and scrolling and having to respond to every comment in this. And I'm learning that balance now, especially because it's affecting my sleep. I think it's a way for you to impact more people.
Absolutely.
And I believe we are blessed to live in a time where we can connect with people on the other side of the world. People in other countries could be listening to your message.
Yep.
And you could be helping them there.
Yep.
And I think we keep that in mind, and then we know how to balance this guy over here.
Absolutely. And I think there's a big move.
Yeah.
What you're doing, what I'm doing is education.
Yeah.
Is educating, not us, just education, understanding, learning in a process by learning from your storytelling, from what your messages are, is learning those through storytelling. And we didn't get into the evolutionary role of storytelling. But storytelling is so powerful for the brain. Has evolved over years.
Yep.
So I wanted to say thank you.
Oh my gosh,
for telling my story.
Thank you. No. Thank you. No, we're honored to have you.
Thank you.